Good afternoon to all present. I extend warm welcome to all the delegates and participants for 3 days international conference on recent advances in biotechnology, bioinformatics, and biochemistry, CONIAPS 26, from 18th to 20th December 2020, organized by Department of Molecular and Cellular Engineering, Sam Hinginbottom University of Agriculture, Technology and Sciences, Prayagraj, in association with International Academy of Physical Sciences, Prayagraj, and Mahatma Gandhi University, Kottayam, Kerala. Allow me to invite Mr. Lalchung Bighante, Assistant Chaplain of University, to lead us into prayer. Dr. Lalchung Bighante.
Jai Yeshu. Greetings to you all in the very matchless name of our Lord and Savior Jesus Christ. To begin our conference, I would like to read the passage from Psalm number 139, verses 13 following. For you form my inward parts. You knit me together in my mother's womb. I praise you, for I am fearfully and wonderfully made. Wonderful are your works. My soul knows it very well. My frame was not hidden from you when I was being made in secret, intricately woven in the depths of the earth. Your eyes saw my unformed substance. In your book were written, every one of them, the days that were formed for me, when as yet there was none of them. How precious to me are your thoughts, O God! How vast is the sum of them! If I would count them, they are more than the sand. I awake and I'm still with you. Let us invoke the presence of the Lord. Let us pray. Almighty God, we come to you in gratitude today. Thank you for the beauty and majesty we see in your creation. Thank you for the opportunity to care for the world you have made. Thank you, Lord, for the ability to be involved in useful work and for the honor of bearing appropriate responsibilities. We thank you for this great university, which you have established in your name. We thank you, Lord, for our honorable Chancellor, Vice Chancellor, Pro-Vice Chancellors, Registrar, Deans, Directors, Heads, teaching and non-teaching staff, and all the students. We thank you for the Department of Molecular and Cellular Engineering, for the able leadership, for faculty members, staff, and students, for their commitment and efforts, and the wisdom and knowledge bestowed upon them. Heavenly Father, we ask for your guidance, wisdom, blessings, and divine providence on this international conference on recent advances in biotechnology, bioinformatics, and biochemistry. Thank you for everyone present here today. You truly, Lord, knows what we are setting out to accomplish in this conference. We have an idea, a vision, hints, talents, abilities, and daily instruction. However, Lord, only you can see in perfect detail the end of every beginning, every project, every season, every life. Your righteousness transcends all our efforts and understanding. Therefore, Lord, we come to you this hour asking for your blessings and help as we are gathered together. We pray for guidance in the matters at hand. Bless all our resource persons and help us to learn and engage in meaningful discussion and retain the valuable knowledge and learning experience for the growth and development of our nation and humanity. And most of all, for your glory and for the extension of your kingdom on this earth. In the very matchless name of the Lord and Savior Jesus Christ, we pray. Amen. Jai Yeshu.
Thank you so much, Mr. Gangte. I'd like to invite Professor Kapil Lawrence, Head Department of Molecular and Cellular Engineering, to welcome the guest and introduce the department.
Thank you, Dr. Vijay. Good afternoon from the Department of Molecular and Cellular Engineering, Jacob Institute of Biotechnology and Bioengineering, Sam Bottom University of Agriculture, Technology and Sciences, Schwartz, Allahabad. It is my honor and privilege to welcome all the distinguished panelists, guests, resource persons, and participants to the inaugural session of an international conference on recent advances in biotechnology, bioinformatics, and biochemistry being held here in collaboration with the International Academy of Physical Sciences, Prayagraj, and Mahatma Gandhi University, Kottayam, Kerala. I would also like to welcome the Joint Registrar Schwartz, the Dean JIBB, and convener of the conference, Professor Dr. Engineer Jonathan A. Lal, and the organizing secretary of CONIAPS 26, Dr. Vijay Tripathi, Assistant Professor, Department of Molecular and Cellular Engineering, Jacob Institute of Biotechnology and Bioengineering, Schwartz. I will briefly now introduce the host department, that is the Department of Molecular and Cellular Engineering. The department was established in the year 2000 with the introduction of the MSc Biotechnology program. In 2001, it introduced the undergraduate programs BTech Biotechnology and BSc Honors Biotechnology. The BTech Biotechnology program was the first such program introduced in India along with IIT Kharagpur. In 2004, as the department expanded, the JIBB, the Jacob Institute of Biotechnology and Bioengineering, became its residence. Over the years, MTech Biotechnology and later MSc AG Biotechnology programs were also added to the department's kitty. The department, which started with the faculty strength of 1 professor, 1 associate professor, and 2 assistant professors, now has 3 professors, 4 associate professors, and 10 assistant professors. It is equipped with 4 laboratories, 1 library, and ample classrooms. We have a current student strength in excess of 250 students in the department. Almost all faculty members have doctoral degrees from reputed institutions in India and abroad, and varied research interests ranging from public health genomics, environmental biotechnology, animal biotechnology, plant biotechnology to nanotechnology. Currently, the extramural research grants granted to the department, faculty members by international and national funding agency is nearly 3 crores. The funding agencies, among others, include Global Stars Eureka, Department of Biotechnology, and Rashtriya Krishi Vikas Yojana, RKVY. Our laboratories are well equipped with the state-of-the-art molecular biology instrumentation, and yet the quest for further improvement continues. Once again, I extend a warm welcome to all and wish all success to the deliberations in the conference. Thank you very much.
Thank you so much, sir. Now I invite Engineer C.J. Wesley, sir, Joint Registrar of the University, to give the brief introduction of the university.
Thank you so much. Bible says in Psalms 118, this is the day our Lord has made. We will rejoice and be glad in it. Warm welcome on behalf of Swami University of Agriculture, Technology and Sciences to the distinguished panelists, Director IPZ, Dean, Joseph School of Business, Biotechnology and Bioengineering, distinguished speakers of this conference, and dear participants. I would like to briefly introduce our university to you all. Swami University of Agriculture, Technology and Sciences, earlier known as Allahabad Agriculture Institute, was established in the year 1910 under the leadership of an American scientist, Dr. Sam Higginbottom. Our institution has completed more than 110 years of dedicated and relentless service to the nation with its vision and mission, gospel and plow, and motto, feed the hungry, serve the land. Under the dynamic leadership of our Honorable Vice Chancellor, Most Reverend Professor Rajendra Bilal, Allahabad Agriculture Institute was confirmed deemed to be university status by MHRD Government of India in the year 2000. During our centenary celebrations, that was in the year 2010, the institute, with the permission of MHRD Government of India, renamed as Sam Higginbottom Institute of Agriculture, Technology and Sciences, deemed to be university, to honor the relentless services of our founder, Dr. Sam Higginbottom. In the year 2016, after considering adequate availability of teaching, non-teaching staff, and other essential infrastructure facilities, the Uttar Pradesh legislature decided to upgrade, reconstitute, and establish Sam Higginbottom Institute, a deemed university, into a full-fledged university under State Act. Hence, now we are a state university, Sam Higginbottom University of Agriculture, Technology, and Sciences. Schwartz is a united endeavor of Christian community in India for promoting rural life and development in conformity with the Christian vision of humankind and its creation. University is held in trust as a common ecumenical heritage by the Christian churches, Christian organization of this country. It seeks to be a national center of professional excellence in education and service to the people with the participation of students, faculty members from all over India and abroad. Schwartz operates with Faculty of Agriculture, Engineering and Technology, Sciences, Business Studies, Theology, Animal Husbandry, Humanities, Film and Mass Communication, and Health Sciences. Schwartz is an ISO 9001-2015 certified institution and a recognized member of various associations, including Association of Indian Universities, International Association of Universities, All India Association of Christian Higher Education, Association of Commonwealth Universities, Asia Pacific Association of Agriculture Research Institutions, Global Consortium of Higher Education, and many more. We have signed many international MOUs on academics and research collaborations. NAC accredited us with A grade in the year 2013. MHRD placed us among the A grade institutions in the year 2014 when we were a deemed university in India. We do have 13,000 students pursuing their higher studies on campus with 2,000 teaching and 1,500 non-teaching faculty members all over from India. With these words, I would like to welcome you all on behalf of Sam Higginbottom University of Agriculture, Technology and Sciences, and wish you all a wonderful experience throughout this 3-day international conference. All the best. Thank you.
Thank you so much, sir. Now I would like to invite Professor B.K. Tiwari, Secretary, International Academy of Physical Sciences, Prayagraj, and Professor, Center of Bioinformatics, Pondicherry University, India, to introduce the Academy.
Thank you, Dr. Tripathi, for a nice introduction. Namaskar to all the panel members, participants, and the invited speakers. At the outset, I would like to extend my sincere thanks to the Executive Council and General Secretary of IAPS, Professor P.N. Pandey, for nominating me as an IAPS representative for one of its 11 conferences under the umbrella of CONIAP's 26th which are scheduled to be held at 11 different universities and institutions across India during December 18 to 20. So I congratulate the Department of Molecular and Cellular Engineering, Sam Higginbotham University of Agriculture, Technology and Sciences, Prayagraj, for organizing the International Conference on Recent Advances in Biotechnology, Bioinformatics and Biochemistry. It is for the first time an international conference of the International Academy of Physical Sciences is being organized in online mode due to the ongoing COVID-19 pandemic. We all wish that next conference would be held with the physical presence of the participants. It is a privilege and honor for me on this momentous occasion to welcome all the eminent speakers and participants who have joined this online platform to exchange their experience and research work. Now I would like to brief about IAPS to all the participants of CONIAPS 26. Friends, as all of us know, that science generates solutions for everyday life and help us to answer the great mysteries of the universe. In other words, science is one of the most important channels of knowledge. It has a holistic role in the development of society, like creating a new knowledge, improving education, and increasing the quality of our lives. Keeping in view of these facts, International Academy of Physical Sciences was founded at its headquarters at Allahabad on December 4, 1994 to meet these goals and objectives. The Academy is conceived as a scientific body incorporating various branches of physical, mathematical, earth sciences such as physics, chemistry, mathematics, statistics, geology, geophysics, geography, computer science, bioinformatics, biochemistry, biophysics, etc. Now, its academy is always ready to accept the today's challenges, cutting across the traditional boundaries of disciplines and stretch across the life cycle of innovation from research to knowledge development and its application. It is the basic theme of the academy that the science, technology, and innovation must drive our pursuit for a more equitable and sustainable development. The academy has its constitution with well-defined aims and objectives, which has helped to look beneath the individual subject development and explore its underpinnings in order to learn from the diversity of experience that participants brought to the conference. As per the constitution of IAPS, the administration, direction, and management of the affairs of the academy are entrusted to an executive council. The academy organizes the international conference on annual basis with the name CONIAPS. The CONIAPS is the key activity of International Academy of Physical Sciences to bring galaxies of subject experts from mathematics, physics, chemistry, earth sciences, computational sciences, and allied disciplines in biological sciences at a common platform. The glorious record of the Academy is reflected from its seminal encouragement to the young as well as the established researcher and scientists through its various awards. The Academy gives recognition to extraordinary contribution of the researchers by facilitating them with awards in categories of Gold Medal of the Academy, Fellowship, Honorary Fellowship of IAPS, Swami Saraswati Vedic Sciences Award, Associate Fellowship of IAPS, Professor H.P. Dixit Memorial Award, Professor P.R. Sharma Memorial Award, IAPS Young Scientist Award, and Engineer Vivek Mohan Memorial Young Scientist Award. The Academy has established two memorial lectures, Professor R.S. Mishra Memorial Lecture in the memory of the Professor R.S. Mishra, Padma Shri, and founder patron of IAPS. Professor T. Pati Memorial Lecture in the memory of Professor Trivikram Pati, the first gold medalist and sixth president of IAPS. Since the inception of IAPS, only 3 eminent personalities were awarded its highest award, Gold Medal of the Academy, for their notable contribution to the academy, science, and the society. These eminent personalities are Professor T. Pati, Professor S.P. Dixit, and Professor B.M. Supla. The Fellowship of IAPS and the second highest award of IAPS was established in 1996 to to acknowledge from abroad, 19 are from abroad belonging to US, France, Japan, Poland, Canada, Czech Republic, Italy, Thailand, and Nepal. The academic institution, the Young Scientist Award in the year 1997 to promote and acknowledge the potential of young researchers up to the age of 35. Today, 74 young researchers have been conferred with the Young Scientist Award. The philosophy of the Academy is not only to promote modern sciences, but also concerned with the promotion of Vedic sciences. In this regard, Swami Vajanand Saraswati Vedic Science Award was instituted in 2010. To date, 4 distinguished thinkers and researchers have been conferred with the award. One of the notable names is His Holiness Jagadguru Shankaracharya Swami Nishchalananda Saraswati Ji Maharaj, Puri Pitham. For the holistic development and promotion of research, encouragement to researchers of all age groups is the demand of the hour. With the cognitive belief, the Academy has started IAPS Associate Fellow Award in 2018 to promote potential researchers in the middle age group. To encourage the researchers up to age 45, Academy established 2 more awards in the field of mathematics in 2018 and 19 respectively. These awards are named Professor H.P. Dikshit Memorial Award and Professor P.R. Sharma Memorial Award, and till date, 3 researchers have been conferred by these awards. For the promotion of interdisciplinary scientific research, Academy provides a platform with its journal to bring notice to the scientific community about the research work of young researchers in the areas of physical sciences. The Academy is publishing Journal of International Academy of Physical Sciences continuously since 1997. This journal is an internationally exchanged peer-reviewed journal publishing quality research papers without charging any fee. During the journey of 25 years, the Academy has achieved many milestones, which are reflected by its recognition by the national and international research workers and institutions. The annual conference of IAPS have traveled to every region of the country. Besides it, 2 conferences were held at Thanyaburi, Thailand in 2012 and Kathmandu, Nepal in 2018. The Academy celebrated its silver jubilee in the year 2019, last year, magnificently with profuse academic activities throughout the country. There were 29 academic events spread over 19 states and union territories of India. In the series of events, 2 international conferences, 14 national conferences, 4 national seminars, 7 national level workshops, 1 short-term course, and 1 national level symposium was organized. The series of academic events was concluded in the 25th International Conference of International Academy of Physical Sciences at Guru Jampeshwar University of Science and Technology, Hisar, during 28 to 30 December 2019. So on behalf of the IAPS committee, I extend my thanks to the Vice Chancellor, Registrar, and Administrative Staff of the Sam Higginbottom University of Agriculture and Technology and Sciences, Prayagraj, and faculty members of the Department of Molecular and Cellular Engineering, Schwartz, for organizing this conference. So we are very delighted that this time the Schwartz is organizing such a conference, and especially in biological sciences, different branches of biological sciences, and it is emphasizing on interdisciplinary interaction among different disciplines. So let me close by wishing you a delightful and stimulating 3 days of conference. Once again, I welcome you and thank you all for your online presence and valuable contribution during the conference. Thank you.
Thank you so much, sir, for the nice information. I, Dr. Vijay Tripathi, Organizing Secretary of this conference, going to introduce the CONIAPS 26. The CONIAPS 26 is an international conference on recent advances in biotechnology, bioinformatics, and biochemistry, organized by Department of Molecular and Cellular Engineering, Jacob Institute of Biotechnology and Bioengineering, Sam Higginbotham University of Agriculture, Technology and Sciences, Prayagraj, in association with International Academy of Physical Sciences, Prayagraj, and Mahatma Gandhi University, Kottayam, Kerala, India. The theme of the conference is recent advances in biotechnology, bioinformatics, and biochemistry. Since its inception, biotechnology has also evolved through different eras. We have witnessed remarkable techniques like recombinant DNA technology, transgenic technology, gene therapy, protein engineering, and CRISPR-Cas based gene editing tools. The judicial application of these techniques to sectors like health, food, environment, medicine, etc., is what holds the key for sustainable development. Biotechnology is the amalgam of biochemistry, bioinformatics, and microbiology. Biochemistry, which forms the backbone of biotechnology, as a field is very cardinal for understanding the various biochemical phenomena happening around and in us. As research in developing day by day, the biological data compilation and processing is a mammoth task. Bioinformatics aid is providing a speed and accuracy with its technological advancement like in silico biomolecule interaction with potential drug molecules. Together, these domains of life sciences are unveiling new discoveries in biological sciences. CONIAPS 26 aims to enrich the strong liaison between scientific and technological fraternity. This conference offers a platform for leading academicians, scientists, budding researchers, industry persons, and students from around the globe to exchange knowledge, ideas, challenges, and advances relevant to the development of the subjects encompassing biotechnology and its allied areas. CONIAPS 26 features invited lectures from renowned academicians and scientists, oral presentation from participants from all over the world. I am sure that this conference will definitely expand the horizon of ideas in the young minds to proceed further with existing research in the field of biotechnology. Now I request to Professor Jonathan Elal, Dean Jacob Institute of Biotechnology and Bioengineering, and convener of this conference to address the delegate. Professor.
Thank you, Dr. Tripathi, and thank you, Professor Lawrence, and thank you, Professor Tiwari. First of all, I would like to welcome all the panelists and all the attendees for this international conference. I welcome you all. I'm the Dean of Biotechnology. I was supposed to introduce you to the chief guest of today's event, Dr. Renu Swarup, who is the Secretary of the Department of Biotechnology, Ministry of Science and Technology, Government of India, New Delhi. Unfortunately, due to some urgent meeting, last moment she had to cancel, which is very unfortunate because we were so forward looking to her lecture because we also received grants from her department of the Government of India. But unfortunately, she could not join and she has sent her apologies. So hopefully we should be able to get her next time. That is one thing. Nonetheless, I must congratulate all the organizers of this event, this international conference. And I must say that, okay, we have done a few conferences online, which is unusual, and we're slowly getting familiarized to this process. However, of course, we all have to agree to the fact that offline physical conferences is still the best. And due to COVID-19, unfortunately, we all have to do this online. But the show must go on, as they say. Now, I must also congratulate the team. We in biotechnology here, according to newspapers, we have been the top 10 biotechnology colleges of the country. And at the same time, we have multiple grants amounting to 4 crores. At the moment, we have grants from DBT, of which our secretary was supposed to come. We have a grant from Global Stars Eureka, which is a EU India grant, and we have collaborated on different aspects. At the same time, we have grants from the state governments and from the central governments. And we have several other research. We do world-class research at our institute. And I must say, as the conference says, in recent advances in biotechnology, bioinformatics, and biochemistry, biochemistry has always been, as Professor Kapil Lawrence may agree with me, the backbone of biotechnology. And at the same time, we should not undermine bioinformatics, because just with molecular biology and the technology at our disposal, we took several months to years to do stuff. For example, sequencing, among other stuff. However, with bioinformatics, Dr. Kant, the head of the Department of Computational Biology and Bioinformatics, will agree with me that bioinformatics plays a pivotal role in biotechnology. Now, when we started off, as Professor Lawrence said, we were the first batch in the country along with IIT Kharagpur. There is no association with IIT Kharagpur. It is just that when they started the same year we started, so we were both number one in that aspect, that we started the BTech biotechnology program in the country. Now we have so many BTech biotechnology programs spread all over the world, and also of course in India. What I must also say is that we are the first institute in Southeast Asia to offer a degree in agriculture engineering, dairy technology, and agriculture as well. So I think this university, of course, we first established as the Allahabad Agricultural Institute in 1910 by Dr. Sam Higginbotham. And then we became a deemed university in the year March 2000, and we became recently more of a university under the State Act, granting aid university from the state government in December 2016. And we have over 13,000 students, and we have over 1,500 staff members. Now, given the COVID-19 situation, first of all, I wish you all safety, because that is why we have this conference online. And of course, our department has experience in organizing conferences even before this online. However, we would always prefer offline. Now, COVID-19 has played a huge impact in all our lives, but as we all know, both biochemistry, biotechnology, and bioinformatics has played a huge role in dealing with COVID-19. The vaccines which are coming out, hopefully next year, is and only because of biotechnology, its computational power in bioinformatics, and the chemical aspects, the biochemical aspects in biochemistry, only because of which we are able to develop these vaccines. When other previous viruses spiked across the world, biotechnology was the answer to it all. Biotechnology was able to resolve those problems in the past. However, today's problem is unprecedented, is that it is after over 100 years, we're having a pandemic. We did have epidemics. Epidemics were localized, large scale spreading of viruses, novel viruses, new viruses, but they got localized. For example, Ebola. Ebola in this sense was one of the most deadliest viruses in the world, but it was so deadly that whoever got it, 99% people died of it. So it did not spread that well. In order for a virus to spread, it has to both kill and it has to allow people to survive to spread it. And that is what this COVID-19 is doing in the current scenario. One of the unfortunate parts of COVID-19 was when the SARS and MERS, the severe acute respiratory syndrome, came out, and the MERS, which is the Middle Eastern respiratory syndrome, came out, which are all part of the coronavirus family, including, of course, the common cold, which is also a coronavirus. There was no need to develop a vaccine, because when MERS and SARS came out, they started working on the vaccine. However, the epidemic, not the pandemic, the epidemic subsided, so they stopped making or working on a vaccine or a solution for it. Now, scientists these days, also those scientists who are in contact with me, say the same thing, is that had they continued working on those particular coronavirus family members, like that is SARS and MERS, they could have very early on created a vaccine for COVID-19. But because the funding stopped, because the virus subsided, is the reason why they were not able to continue research into a vaccine development back then. However, as we all know, vaccines take a minimum of 18 months to be validated, phase 1, 2, 3, 4, to actually come to the market and to be mass produced and utilized. It is unprecedented in the time, in the current market, in the current scientific community. The sheer amount of collaboration on COVID-19 has been unprecedented. It has never happened in the history of the world, the level of collaboration they have done. And if you look, we are already developing vaccines. We, when I say, I mean the global village, not India in particular, but the global village has started production of the vaccines from 95% success rate to 100% success rate, depending on vaccine to vaccine. Whereas in the past, we were not able to do that. And when we talk about repurposed drugs which we repurpose, drugs which are already existing in the market, like hydrochloroquine, among others, they are still being researched. And if we're talking about new drugs, they will at least take another 5 years so we can develop some drug against this particular novel virus. However, I must say I'm grateful to the scientific community, my colleagues in the scientific community. They have worked so hard day and night to ensure that we have hopefully a vaccine within less than 18 months, and hopefully repurposed drugs which we're all experimenting with. But I must say India is doing quite well, is that we have more or less a 95% recovery rate if somebody gets COVID-19. Now, the interesting thing about that is that 95% will survive, right? They will come back home. 5% will end up with severe complications in the hospital. Now, from those 5%, 70%, so if we say 5% is 100%, 70% are those with comorbidities, meaning they have other complications like AIDS, TB, asthma, COPD, cancer, diabetes, among other complications, which further complicate the aspect. So if you have these diseases, you are in the high risk group in the sense that you're most likely to be severely affected to fatality if you contract COVID-19. And of course, old age. So 70% of those 5% are those with comorbidities who do not survive. However, 30% of those 5% are those who are fully healthy. That means there is nothing wrong with them, but yet they still die, unfortunately, due to COVID-19. And that's what makes COVID-19 a gamble, therefore makes it so severely risky. Therefore, I must encourage all the participants, as we see in the news among everything else, is that people are not following the norms of social distancing, wearing a mask, using sanitizers, among other stuff. They're taking things for granted. Now, I have known people personally who have died because of COVID-19, right? SARS-CoV-2, which is the December 2019, which some people use the China virus, which is politically incorrect. It is a coronavirus family called COVID-19. So SARS-CoV-2 causes COVID-19, which is the disease due to SARS-CoV-2. And people must understand, and I thought that this is a nice platform to mention it, is that please do use protection. Please wear masks. Please maintain 6 feet. Do not have confidence in each other when it comes to this virus, because you and I, we may have, say, 95% success rate in India because of our immune system. Of course, this is an international conference. And in India, we, of course, talk about a lot of pollution, a lot of bacteria, a lot of viruses. And we have, of course, according to the Western world, since I've lived a lot abroad, they say it's unfortunately a lot of pollution around the area. So in theory, we have developed a very strong immune system compared to the Western world. So from that perspective, yes, we may have a 95% success rate of recovery from COVID-19, but nobody knows who will fall in that 5%, who will not make it. Over 1 lakh people, more than 1 lakh people have died in India due to COVID-19. And as a result, we already know that 70% of those 5% are those with comorbidities, and the 30% are those who are healthy, which may include you and me. So it is of utmost importance of the scientific community, of those who are literate, to inform people to be aware of this calamity which may come upon you. Because I have lost people I've known personally to COVID-19. And when you lose people, it is heartbreaking, it is heart wrenching. And until it comes upon you, until you experience it, you do not take it seriously. So, as say community service, I would like to say, please take precautions. And vaccine development is coming up, and hopefully by June 2021, things should have subsided significantly. However, in order to vaccinate the whole population of the world, it'll take till 2023. However, we all are very lucky in the sense that this virus is not airborne. The Spanish flu in 1918, 1919 was the last pandemic we had, and that was airborne. But globalization was not that apparent that it did not spread like wildfire. Today, in today's world of globalization, the spread of this virus is very effective because the mortality rate is very low. For example, in India, 5%. Sorry. Well, welcome to India, to our international participants. Uh, in my department, the light went off. So because of that, unfortunately, I got disconnected. So as I was saying, I'd like to welcome you all. And first of all, biotechnology plays a significant role in everything, in all aspects of life, which we may or may not realize. And I must say that our college is doing pretty well with regard to research. We're working on STDs, sexually transmitted disease at a molecular level on molecular diagnostics. You should be hearing that tomorrow by Professor Saraswati More, whom we're also collaborating with. He's a professor of public health genomics and molecular diagnostics in Netherlands. After me, one of my personal friends, Dr. Dennis Horgan, the executive director of the European Alliance for Personalized Medicine, will be talking. As we see, personalized medicine is the next frontier we're going to explore. Medicine, among others, and personalized medicine is driven by biotechnology, and I think that is where we're going with. And I'm pretty excited to look forward to this conference, the way we move forward, because this conference will indeed give us insights and knowledge of the various world-class research going across the globe with regard to biotechnology, bioinformatics, and biochemistry. And I must say, biotechnology has contributed a lot. All those people who are attending, in principle, I presume they would agree with me that biotechnology plays a very important role in all aspects of our life, whether we know it or not. And I think, of course, medicine and vaccine and viruses is a more recent issue. So that has been more highlighted with biotechnology. But with regard to food, with regard to with industry, biofuels, among other stuff, biotechnology is everywhere. So even if you're sleeping, you should thank biotechnology. That is what I'd like to say. With this, I'd like to conclude. Thank you very much. And I give the mic back to, if I don't have a mic, it is the mic in the laptop. Since we are online, I give the mic back to the organizing secretary, Dr. Tripathi. Thank you very much.
Thank you so much, sir, for the nice information. Now I hand over to Dr. Pragati Mishra, Co-Organizing Secretary, CONIAPS 26, for further proceedings.
Dr. Mishra.
Thank you, Dr. Vijay. Now it's a very important responsibility. Now I'm going to introduce today's chairperson, Professor Dr. MP Singh. Professor MP Singh is presently working as professor in the Center of Biotechnology at University of Allahabad, India, and heading the Center of Biotechnology as well as Bioinformatics as a coordinator. Professor Singh successfully completed 6 projects and presently having 1 research project in hand. He established mushroom production, training and research center with financial support of UGC at VBS Purvanchal University, Jaunpur in 2012, when he was head of the Department of Biotechnology there. The center is catering to the need of local farmers by providing training in mushroom cultivation and skill development. He edited 5 books on biotechnology and published a large number of research papers, book chapters, and popular articles. Professor Singh is in editorial board of many reputed international journals. Professor Singh is an inspiring teacher and an ardent researcher. His research group is working on mushroom biotechnology, on therapeutics, nutraceuticals, bioremediation, computational and metagenomics, anti-infection, etc. I'm very happy to say that Professor Singh is also working as visiting professor in the Department of Chemistry and Biochemistry at University of Maryland in Baltimore County, USA, from 2019 to 2022. Thank you. Now I would like to invite Professor MP Singh for chairing today's session. Now I'm handing over to Dr. MP Singh.
Sir,
please unmute your mic, sir. Please unmute your mic.
No, am I audible? Hello.
Yes, sir. Yes, sir.
Yes,
You're
sir.
audible.
Yes, sir.
You're audible.
So, very good afternoon, colleagues and friends from India and abroad. It's my pleasure to be here to interact with you once again. And as Professor Jonathan was telling, because of the COVID-19, we are interacting online. And when we are interacting online, I always remember when there is a will, there is a way. You know, there are many obstacles, problems we are facing, but still we are enjoying the online interaction. Because what I have found in the beginning, some of the speakers' voice was not audible. Some of the videos were just still, but still some of them was very clear. Vijay Tripathi was very clear. Professor Jonathan was very clear, except a couple of minutes when because of the light became off. So with this, let us enjoy the interaction in the online mode. Offline is always better, but let us enjoy this in online mode. So I'm pleased to preside this session, and as we are having the time slot is very clearly given, so I hope the speaker will stick to the time, and this should always be appreciable. So now I think the first speaker is Dr. Dennis Organ, isn't it? Am I right?
Yeah, a good pronunciation.
Oh, because you just forgive me for I was thinking that I don't know my pronunciation regarding, but nevertheless. So Dr. Dennis Organ is the Executive Director of the European Alliance for Personalized Medicine, EAPM, as Dr. Professor Jonathan has already told. Net of relevant stakeholders involved in developing an environment for personalized medicine at the EU and national level. He supports successful policies that foster activities for a more effective, targeted, and safer therapies for patients across Europe. Prior to working with the EAPM, Dennis worked with European Cancer Patient Coalition and in the European Parliament on broad array of health issues relating to the pharmaceutical area and patient access, and with international NGOs on health development projects in Afghanistan, Mexico, and Palestine. He holds an LLM in international criminal law and master's in management from London School of Economics. So we are having such a wonderful resource person like Dennis Horgan. Now I invite Dennis for the lecture. Dennis, please.
Thank you so much, and delighted to be here today. And thank you for the nice introduction, which was great, and also for Professor Jonathan Lal for the kind invitation to be here with you today. So it's a great honor that I can speak to you today. So one conflict of interest that I should say that I'm not a medical doctor, so I apologize, but I will speak a lot about medical issues in terms of personalized medicine, which is my main focus. So my background is a lawyer. I started off as a lawyer, and then I worked primarily in international work, as you mentioned, with a specialization in international criminal law. And then from there, I worked at the European Parliament for a number of years. And then I'm primarily working in regulatory policy. So how to facilitate political and policy change to bring healthcare innovation into healthcare systems. And this is the key issue when we look to COVID-19 or look to different challenges, when we look to treating cancer patients or looking to utilize different areas. So because we have a lot of new science coming from different centers. If you look at oncology, a lot of development in the issue, how do we utilize data? There's a lot of development in regulatory and policy issues. And then the world is smaller. I mean, although countries are big like India, the world is small in terms of how we can bring science and innovation to healthcare systems. So my talk will very much focus on the European region, what we're doing in the European region to facilitate this terminology that we call precision medicine or personalized medicine that we have termed it in the European region. And I will give an overview of the political and policy areas. I will try to keep it in my 20 minutes that I was allocated, but I can be quicker, as I'm from Ireland, so sometimes I speak quite fast. So I think I can show some slides if I'm allowed, but I'm not allowed to show it. The host is disabled me.
I think slides are okay. Slides are outside.
Okay,
Dr.
please. Sure. It's always pleasure to see your slides.
Yeah, I can. Someone needs to allow me to. The host needs to enable me to do this.
Dr. Tripathi, please ask Dr. Wesley to enable Dr. Dennis to show his slides.
Okay, sir.
So Europe, I mean, I can talk about Europe. Europe, as with India, it's a complicated area with a long history, with many big, strong countries like states, like you have in India, and a lot of them have different political interests, a lot of historical, how they came about, and the question is, how can these countries work together and cooperate together more effectively? Within the European region, there was 500 million, 530 million people there within the population. Oh, I can share now, I think. So you should be able to see my slides.
Visible, yeah.
Yeah, okay. So now there's this young lady, or not so young, depending how you see her. And this lady is, she's the president of the European Commission, and she came into office in the last year. I know she has put a prime focus on the issue around health union. How can Europe work together, developing a healthcare priority, and how can we better bring innovation into healthcare systems? Europe produces 30% of all academic publications in the world. But unfortunately, we don't bring this bring the outcome of this research into healthcare systems, nor do we commercialize this. And the question is, why has Europe failed to do that? I assume the same in India, that you have a lot of great researchers and a lot of people produce a lot of science, but often it's the Americans that commercialize this, or the British. And the question is, how can Europe facilitate bringing more investment or incentivizing this investment to drive forward innovation in healthcare systems? When we look at the area of personalized medicine that I mentioned that we primarily focus on, this is the definition that we utilize. And this covers, of course, a lot of terms that talk about personalized medicine or precision medicine, but the definition that we've came up with in 2015 that was endorsed by all countries was characterization of individuals' phenotypes and genotypes linked to molecular profiling, medical images, lifestyle data, preparing the right therapeutic strategy to the right person at the right time, or determine the predisposition of the disease to allow for targeted prevention. There you can see different terminologies: molecular profiling, medical imaging, lifestyle, and a question also around targeted prevention. So the question is the real story of personalized medicine is not about therapeutics, which is of course very important, is the issue around how to identify patients or citizens earlier so they can treat them quicker. And this has an advantage, as with COVID, to understand where disease burdens are, or which targeted population group or stratified population group would have certain diseases. But of course, healthcare systems itself needs to be changed. How to do this? Because healthcare, compared to other industry, have not changed over the years. They have not taken on the latest type of innovation to bring this into healthcare systems. Only until COVID, we can see a movement in telemedicine, or a movement in how the willingness of healthcare systems to share data. And this has resulted in how the vaccination was developed by different companies globally, and how this was given market authorization, because there was a willingness to share data so the regulators can have a better understanding what the clinical impact of this, but also payers can also understand whether reimbursement decisions can be made. So the idea of personalized medicine, which I won't go into too much detail, is how can we have better medical intervention so that we can focus on the patient, not only the disease. So how do we take account of the different factors why a certain individual will get certain diseases? And because now sequencing a genome has dramatically dropped, in that the cost of a sequencing a genome in 2000 was over $1 billion, and now it's dropped down to below $1,000, so around 750 to 600. And the question is because we can understand the human genome better, how better to bring this science into healthcare systems and move forward with this. But a key question is there's a lot of ineffective treatments existing, a lot of side effects. A lot of women are getting chemotherapies when it's not needed. And this creates added burdens because people cannot work. The question is, how can this be improved? How can we have better diagnostic methods that can be put and applied in healthcare systems? With better diagnostics methods, you need more healthcare workforces, you need more pathologists, you need more mechanisms how we can share data. And this data has to be secure. So the question is, how can this be done so that we have better value of diagnostic information? But a question around diagnostics as well is around the issue of whether the healthcare system reimburses these diagnostic techniques, because often they only reimburse the therapeutics, not the diagnostics. So the broader policy case needs to be made why patients should focus on, why should society in general invest in the area of precision medicine oncology, or precision medicine across the different diseases, even in neurology, where there's new biomarkers that are coming up. And the question is, how can this be done more effectively so that we can detect and treat patients? And this is the key question to citizens themselves, men and women and children, to understand that they need to get, if they have different types of diseases, or is a family history of this, or they have some effects, that they should try to get tested earlier. So if you have a stage 1 cancer, you can get treated earlier. And a lot of late diagnosis, if we come to lung cancer, is down to late diagnosis, which leads to earlier death. And the question is, how can we have better screening programs or stratified screening programs that can support this? And these all need the involvement of society. As with the vaccinations that we're talking about with COVID-19, you need the trust of the citizens, how they can be involved to drive forward this type of technology. Of course, the healthcare systems can have a benefit because, of course, a lot of issues when we talk about these type of therapies that are developed by different pharmaceutical companies, they're often focused on the cost issue. But the question is, how can cost and money be better allocated in society? Of course, there's a lot of inefficiencies in healthcare systems. So how can we better rationally allocate resources so that they can be more effectively utilized? So how can we have better diagnostic techniques? How can we empower different specialists working together on molecular tumor boards so that they can have the resources to see and give a medical treatment to different types of patients? And there you need more of a collective togetherness within a broad country like India or within Europe region, to say that because all countries kind of not have all the expertise, there needs to be a willingness to work in cooperation. And how can they share data to do this? The same with the healthcare industry. The healthcare industry itself needs to work more in collaboration between the pharmaceutical companies, the diagnostics companies, and also the IT companies, the data companies, because as I mentioned at the very beginning, we have this issue where we have a perfect storm in terms of more data, more science, more regulation, and people want better health. So the question is, how can R&D costs be brought down? And then how can drugs and different diagnostics be approved at a quicker pace? So these are key questions which need to be tackled from a policy and regulatory level. And then from a broader societal view is, how can we have better decision making? How can the broader society be involved in this decision making framework so that society can invest in this in earlier as a global, as a regional, say within Asia and India taking a lead, but how can we have better diagnostic techniques so that these will become reimbursed so that industry can get funding for this and then develop more innovation going forward? And this is a key question of the use of data. How can this drive these issues forward? So this links into some of the regulatory issues when we look to the issues around big data. And what is big data? It's just a lot of data, a lot of small data, which is big data by definition. But the question is, what is the relevant patient population for gene therapy? So we have a lot of these gene therapies that will be coming up. How can these get into healthcare systems? What are the manufacturing processes for this? How can different specialists decide whether these should be given or not? What is the incidence and outcome of different infectious disease? What is the compliance of the elderly? What are the long-term health benefits of a new treatment compared with standard treatment? How can should we have serological testing, for example, with the use of vaccinations? And how can this be better? Whether society should invest in this, but what are the registries that will be utilized to collect this data? And this comes into the area of COVID-19. And then what are the genetic susceptibilities to adverse drug reaction? And what are the genetic basis of responders to non-responder status? So these are a lot of questions which I don't have answers to. I won't answer them. But these are questions that which the regulators in from the European Medicines Agency look to, and how to derive these issues. But a key issue of the whole area is the benefit for the stakeholders. And what we try to put forward in different regulatory issues. So we have different regulatory issues such as the medical device regulation, the in vitro device regulation. You have big funding. You have 5.4 billion euros going into healthcare funding at the European level now. You have the whole issue around European data governance. Why are all these policy and regulatory frameworks important? Because it can bring down the cost of different issues. Because at the moment, there's a lot of bureaucracy that causes a lot of additional cost, for lack of a better word. And how can we bring down the reducing cost of development? How can we optimize education? How can we develop new outcome measurements? So what are the agreed outcome measurements that a different technology assessor should understand, but also from a regulatory perspective understand? And so that they can have an earlier dialogue before a lot of money is invested in certain type of treatments or diagnostics which will not get a reimbursed. And what is the effective data needs? And how to better identify patients that may have certain diseases. All these are different issues that all countries are facing. When we look to Europe, then, Europe has different policy focus. As I mentioned, my primary focus is on the area of policy, so it has different focuses on. One is this area on cancer, which is going to have a focus, which a plan will come out at the beginning of 2021. And these are broad pillars that you have: prevention, diagnosis, treatment, and quality of life for patients. I will spend a lot of my talk on the issue around biomarkers shortly, but these are the key issue in terms of trying to get the member states, countries, 27 countries, it used to be 28, which included the UK. Now we will have 27. We don't have UK, so we hope it will be easier to reach agreement because we don't have the English there. But we will try to now work and try to have a more common framework, how we can work together to tackle some of these questions. Because at the European level, a lot of countries, and I assume in India maybe as well, a lot of states may be creating a duplication. So how to avoid certain universities or certain centers duplicating? So how can resources be better spent in a different area? The other key issue is how to better utilize data and how to better utilize data in the issue of genomic data. And what we created at a European level for over the last 3-4 years is how we can create a European health data space. And this is resulting in a legislative framework in how we can exploit the data from all these genomic data that we have. Because it's very easy, as I mentioned now, because the cost of sequencing has dropped so substantially, but how can we better utilize this data? Because there's no point sequencing just a sequence. We need to understand how the mechanisms of different disease areas, from different rare diseases, which were just subdividing different existing diseases which were before, and how can this be exploited more effectively to drive forward this. And that led to a declaration that we drafted for the European Union, which led into this 1 million genome project. Why 1 million genome? Because we wanted to have a big idea, and the acronym fed into MEGA, Million European Genome Alliance. So it could be a billion or it could be a trillion, but it was easier TEGA than HEGA. So MEGA was good since we had Trump in the White House that had his MEGA approach, Make America Great Again. And this has resulted in many countries getting involved. So one of the key focus that we're focusing on at the European level is focusing on how to bring this regulation and policy into drive forward innovation. And one of the key issues there was in the area of biomarker testing. Of course, different countries and different markets have different markets in terms of economic markets have different abilities to bring certain types of innovation. So you can have basic biomarker testing, such as BRCA testing, and then you have more advanced markets such as advanced molecular diagnostics, such as comprehensive genomic profiling. And what are the levers and drivers that one can support this? Of course, when we look at political and policy areas, one has to divide it down into different areas to take account of the different focuses of the patient organization, patient, clinicians from the different specialist backgrounds, the regulators, what they're expecting, industry, and then you have also the science coming from different universities. So the question is, looking at how can science is evolving, how can this be brought into systems? Governments, of course, promise many things, but the question is, how can this be realized? And then you have different asks from different patients, of course, want to get better treatments, and healthcare systems, that's the same thing. But across the European region, not all patients have access to biomarker testing to inform treatment decisions. Of course, this leads to delayed treatment. There's a lack of funding or lack of reimbursement. There's different system challenges. And there's a lack of clear guidance. Different countries do things different ways. The question is, why is there not an effective guidance that each country follows the same way, so then it's better utilization, so we better can capture data, so that we can say how different approaches should be taken in a more systematic way. And then the different registry data that are stored in different way, which leads to these problems of interactivity between different types of databases. So one of the issues in terms of improving a minimum standard of care in terms of biomarker testing is, I mean, of course, you want an overall objective to ensure that patients have high quality access to biomarker testing. You need a clear process to be put in place. You need clinical practice. And then a lot comes from the medical societies that are producing different guidelines. How are these guidelines supporting and implemented into healthcare systems? So of course, then you need clear reimbursement lines in terms of how these different technologies are reimbursed. You need proper quality metrics between different areas, and you need proper horizon scanning. So earlier dialogue with different regulators to see whether these type of diagnostics will work effectively and whether they will be reimbursed, but also their infrastructure around that, so that there's a sufficient pathologist that can support the analyzing of this, but also data scientists that can support the communication of this in different types of formats. And this will lead then to more impact in terms of more informed treatment decisions, more equal access to the knowledge of biomarker status and targeted treatments. Because we can avoid the best therapeutics, but if we can identify patients earlier, then this will struggle. So what we've put forward in terms of this cancer plan that I mentioned is to have an minimum essential package of diagnostic tests that are available, but the infrastructure that will support bringing this into different healthcare systems. And how can these be better funded so that you can have more impact for the patient? If we look at the issue around optimal, the issue around how better, so a system that has sufficient labs, that has the sufficient resources there, but how can they use better molecular diagnostic testing? And often is insufficient economic interest from different developers to develop these advanced molecular diagnostic tests, because simply they're not getting reimbursed. So it needs to be more coordination between at the European level. As I mentioned, it's a very fragmented healthcare system at the European level because we have different countries that have their own system. Like in England, you have the NHS, but each country itself has their own national health service. And some states are centralized and more are broken up into different regions. So the question is, how can have more of a common approach? And this is one area that we're working on, so that there can be a clear relationship between the biomarker and its expected value. And so that's a question of reimbursement again. And then what are the testing standards? Because different labs would have different procedures or different protocols. And this then leads to a discordance in terms of the evidence framework, that what are the standards or endpoints that different users will look for. And this leads to different market failures. Payers are not reimbursing, and this leads to access issues. And then the slow uptake of these biomarker tests. And then there's really a lack of robust data sets in terms of lack of interoperability, because you have different IT systems in different regions, which leads to these problems. And then you have limited education. So the question is then, a key objective is to tackle this issue around early diagnosis by having a functioning healthcare system, by having a data system that allows the collection, storage, visualization, and usability of this data, having a properly resourced healthcare system in terms of clinical staff, but also the technology that will allow the labs to provide additional information to report back. Of course, COVID is not comparable when we look to cancer, but a lot of the lessons that have come to the surface in COVID highlight these issues. So one needs to incentivize the healthcare system to adapt. And what are the interests of the healthcare systems to adapt, which I was setting out earlier, was that this can lead to efficiencies, especially in the area of biomarkers. So there needs to be better education in terms of the different key stakeholder groups that they can utilize these different signs. And there's different inputs again. There's similar issues that were addressed earlier. A lot of when I talk about these are DGs or directory or ministries at the European level. But the question is, how do you incentivize different data? So what I mentioned earlier was we're developing this European health data space, which will be a European data governance framework that will provide a governance framework how countries can work together. Then you have a European pharmaceutical strategy that will support the pharmaceutical and diagnostic industry to cooperate together, so incentivize this. We're focusing on the orphan regulation, pediatric regulation. So how do we incentivize more investment in the rare disease and rare cancers area? And then the whole issue around tackling basic issues of healthcare workforce needs. So these are key issues that we're looking at. And this issue then links to the better utilization of these catch-term phrases like real-world evidence. So how can we better capture data to better utilize the data to make reimbursement decisions and policy decisions? Of course, it's nice to have plans, but one needs funding. And a lot of funding in terms of the area of funding is focused on the issue in cancer. In one area is focused on these policy priorities, which are 1 to 13. And different areas there that we're focusing on in different areas, from oncology to rare disease to neurology. And a lot of funding will go through they're called missions at the European level. And how can we have better cooperation between different healthcare systems to drive this forward? Of course, society itself needs to agree to that. So of course, we need to learn from colleagues in other regions, such as in India, what they're doing to support the better implementation of science. And this is a bridge that connects two countries, Sweden and Denmark. Of course, only a certain number of people will utilize this bridge that costs 2 billion euros to build. But the question is whether society itself should invest in that. And this connected two villages together. So it's similar with we're investing in the future. One must say this is a good investment to stimulate different communities working together to drive forward innovation. And this is the conclusion of my presentation. I hope I stayed within the time limit. Please.
Thank you, Dennis. Hello, am I audible?
I hear you.
Yeah, we all hear you, sir.
Oh, thank you so much. Thank you so much for such a informative lecture. And you have focused on the healthcare system, on the personalized medicine, which is a need of the time. And you have rightly said that the 20th century, in the 20th century, microscope and X-ray is revolutionized, and in 21st century, genomic data has revolutionized. Because if you want to have the solution, you have to have the genomic data, and then only you can go ahead. So now I invite questions from the audience. Anybody? A couple of questions we can.
Dr. Singh?
Yes.
Just one single comment from me. What Dr. Horgan has presented is very vital importance for us in the Indian scenario. Because as we know, our healthcare system is broken. It is decentralized. We do not have a uniform healthcare insurance policy, and hospital from a village all the way to a metropolitan. So basically, I must say there is a lot to learn from the European scenario, and that is why Dr. Horgan's presentation is of utmost importance to this conference, because we can learn a lot from his experience and how personalized medicine is taking a role in Europe. And I must say personalized medicine is at the forefront, and beyond personalized medicine, they're now going to precision medicine. And they have their house in order and still they have complications. So I must say we have a long way to go with regard to our own healthcare and then to get our house in order. So that is only my comment I have. Thank you, Dr. Horgan, for your presentation. Sir, back to you, Dr. Singh.
Your comment is very right, absolutely correct, and you have rightly said. Question: anybody who wants to ask something from the Horgan, please, from audience. Otherwise,
sir, there is a question. The next
speaker.
Dr. Singh, if you see the Q&A on the lower right corner, there is a Q&A from from Prashant Tiwari, sir. You might want to address that.
The question is, my question
Okay.
is, Dennis H. Sir told us about scenarios and solutions in Europe. But my question is that possible to implement this in Asia, especially in countries like India? Yeah, my answer yes. I mean, of course, there's wonderful scientists and researchers that are coming from India, and a lot of them unfortunately went to America and made great companies like Google and other such things. But the question is how Europe is a complicated place. With as I mentioned, you have France, you have Germany, you have Italy, you have Spain, you had the UK, you had a lot of Nordic countries, and it's a complicated place. The question is a system of organization that provides respect to the different states, as in India. And the question is how can we have synergies between different countries? So a university such as Jonathan's University can bring their expertise to stimulate this, and this needs more incentives to bring in innovation. So a lot of different issues can be looked to Europe, but India is special. India has its own way of doing things and its own healthcare systems with its own wonderful and historic history. And of course, India needs to find its way how to do that. And I'm sure there's ways to support cooperation and to drive forward the best innovation that you can improve the quality of life of citizens. But a key issue, of course, the broader issue of education, having systems in place that will allow effective reimbursement, and then convincing the government that healthcare is a key issue that they should invest in. So providing more resources to hospitals and centers of excellence, so then you can drive forward more investment and innovation that we can improve the quality of life of patients. Europe itself is a big region. You have Western Europe, France, Germany, Spain, Italy, which is very, very wealthy. And then Central and Eastern Europe is less wealthy because of historical issues, because they had the Soviet Union and the communism, which itself did not create the economic vitality that they expected. So of course, these regions themselves have to catch up. So Europe is not perfect, but is moving in a way that is trying to have a cohesive approach. So there's many lessons to the question. There's many lessons that can be learned from India and many lessons that can be learned from Europe. And I'm sure together we can try to have a better approach. And then the last question was, what can you suggest, sir, in case of Africa healthcare system scenario? I don't know. It's a good question. I don't have an answer.
Thank you. Thank you. Dr. Dennis Organ, you have very beautifully answered the question. Anybody else? Otherwise, okay. Thanks a lot. The next speaker
sir,
is Dr. E.D.
Dr. Singh. Dr. Singh, sorry.
Yes,
with permission, I would like to request Dr. Horgan to make Dr. Vijay Tripathi the host of the conference. In order to activate your presentation, he made you the host.
Okay.
Could you make Dr. Vijay Tripathi the host? And now I give it back to Dr. Singh. Thank you, sir. Thank you both, sir.
Okay. Hello.
Yes, sir. We can hear you, Dr. Singh. Thank you, sir.
Dr. Vijay, hello.
Yes, sir. You can start, sir. You can start.
Okay. The next speaker. Okay. Dr. Edith Citrin. Dr. Citrin is a senior researcher at the Institute of Soil, Water and Environmental Science at the Agriculture Research Organization, Volcanic Center, and a lecturer at the Harvey University, Faculty of Agriculture and Bar-Ilan University. He completed his MSc in Environmental Science and PhD in Animal Science at Hebrew University, Jerusalem, and postdoctoral training at the University of Minnesota. He is currently supervising 3 PhD students, 2 MSc students, and 1 postdoctoral candidate. Hello. Am I audible?
Yes, sir. Yes, sir. So you can start, sir.
Can you hear me?
Yes, sir. Yes, sir. You can start, sir.
Okay, very sorry for the Dr. Citrin is a microbial ecologist whose research primarily focus on the plant microbe interaction and on environmental dimensions of antibiotic resistant, targeting ecosystem impacted by the reclaimed wastewater irrigation and animal husbandry. His lab implements both culture-based and culture-independent method to delineate microbial communities and antibiotic-resistant genes in the environment, with a specific emphasis on next-generation sequencing-based metagenomics approaches. He is active in several European research networks, including Cost Action, ES 1403, New and Emerging Challenges and Opportunities in the Wastewater Reuse, and Norman Network for Monitoring Environmental Contaminants of Emerging Concern. Furthermore, he is a member of Israeli Interministerial Expert Committee for assessing the impact of antibiotic resistance in wastewater effluents. Dr. Citrin has received numerous national and international grants to investigate antibiotic resistance in agro environments, and he has published over 40 peer-reviewed manuscripts in high-impact periodicals and written 6 book chapters. Now I invite Dr. E.D. Citrin for the lecture. Dr. Citrin. Hello, Dr. Citrin. Yes, please.
Sir, we cannot hear you.
हेलो डॉक्टर विजय आवाज नहीं आ रही है
Dr. Tripathi, we cannot hear the speaker. We cannot hear the speaker.
डॉक्टर विजय साउंड ठीक कर दीजिए
and specifically try to focus at the end on if we are missing something. So that's the catch that we'll hear at the end of the lecture. I would have really liked to have been here live. For specific reasons, I won't be able to.
Hear you now. Thank you, sir.
Maybe we can have questions at the end. I'll see with Dr. Tripathi if it will be possible to contact me somehow. But if not, I'd be very, very happy to answer via email. We know that currently there's a very, very problematic issue in public health with antibiotic resistance, and people have even talked about an antibiotic resistance era, where pathogens are becoming more and more resistant to antibiotics, and not just to one antibiotic, but to multiple antibiotics, phenomenon known as multi-drug resistance, or sometimes these bacteria are called superbugs. And we see an increase globally in antibiotic resistance and in multi-drug resistance. And there are projections that by the year 2050, we're going to see huge amounts of mortality annually, especially in developing regions like Africa and in Asia, due to multi-drug resistant pathogens. And we know that resistance and multi-drug resistance is obviously due to selection. So the more antibiotics population is exposed to, of course, the more the resistant strains will proliferate. And of course, the more types of antibiotics we use, the more multi-drug resistance we'll have. Another really, really important factor for antibiotic resistance is horizontal gene transfer or lateral gene transfer, where genes harboring or elements harboring genes conferring resistance to antibiotics can be transferred and acquired by different bacteria. This can occur through conjugation, so plasmid transfer from one bacteria to another. And it's very important to know that many plasmids not only harbor one gene for antibiotic resistance, but some have several, up to 15 or even 20 different genes. And this, of course, can directly lead to multi-drug resistance. But we know that DNA can be taken up by transformation and also by transduction through bacteriophages. So we have various mobile elements that can contribute antibiotic resistance genes. And if we think about selection coupled to horizontal gene transfer, this is really causing propagation of antibiotic resistance. Now we know that antibiotic resistance is very, very significant in hospitals and in the community, but there's an increasing realization that we have to use a One Health approach to look at antibiotic resistance in the environment as well. We know that animal husbandry and aquaculture use a tremendous amount of antibiotics. Hospital and community wastes go into wastewater treatment facilities, or in developing countries, often raw sewage is directly discharged into freshwater bodies like rivers and lakes, into agricultural soils through irrigation. And we have to really look at this whole spectrum of events in order to understand the factors that influence propagation of antibiotic resistance. Now, in Israel and many other regions of the world, water is becoming more and more scarce. If we want to have a flourishing agricultural sector, we need to have alternative sources. And in Israel, treated wastewater is a very significant alternative source of water for irrigation. And we can see that right now, over 50% of the water that we use here for irrigation is recycled. So treated wastewater that's used for irrigation. And if we look globally, considering global climate change, considering growing populations, we know that the reuse of water is going to become a larger and larger or more and more significant source globally, and we really want to understand the risks of using treated wastewater for irrigation. Of course, from a public health perspective, we often look at fecal coliforms or E. coli as markers or as models for estimating fecal pathogens. And we know that in many of the countries that reuse water, like in Israel, fecal coliforms or E. coli are used to determine maximum amounts per, for example, 100 ml of water. So in Israel, for example, for unlimited irrigation, we can have no more than 10 fecal coliforms per 100 ml of water. If we're talking about discharge to rivers or lakes or use in things that aren't edible crops, we can have up to 200 fecal coliforms per 100 ml of water. Okay, but looking specifically at pathogen indicators like fecal coliforms does not give us an estimation of antibiotic resistance. And it seems that in the future, we might see, like in this white paper from the European Commission, specific requirements for estimating antibiotic resistance, and that's something that hasn't been done yet. So the main questions that we're asking in my lab are, does treated wastewater irrigation enhance the abundance of antibiotic-resistant bacteria, but also the abundance of antibiotic resistance genes? And we talked about horizontal gene transfer, and therefore many, many studies don't only look at bacteria, pathogen indicators or total bacteria, but they also look directly at genes in water, soil, crop DNA in order to estimate the abundance of specific antibiotic resistance genes. Now I'm going to give a number of examples. The first is a study done by Tamar Kozer, who was a master's student in the lab. Tamar was specifically looking at multi-drug resistant E. coli from wastewater effluents. We looked at 3 different wastewater treatment plants in Israel, 1 very large plant, 1 medium-sized plant, and 1 small plant. And Tamar collected a very, very large collection of antibiotic-resistant E. coli. She did antibiotic susceptibility testing to look at their phenotypes. And also, for 2 strains, we sequenced the genomes in order to correlate between these phenotypes and specific genes associated with antibiotic resistance. So to summarize, and here we only see the most multi-drug resistant isolates that Tamar had. Over here, we can see the different strains from the 3 different treated wastewater samples. Here are the different antibiotic compounds that we screened against, and these are basically families of these antibiotic compounds. And the black squares represent resistance to a specific antibiotic, the white susceptibility, and gray are intermediate. Now, one thing that we can see here, which is very, very interesting, when we look, for example, at the aminoglycosides, and we try to look at when different antibiotics were actually introduced for clinical use, we can see that kanamycin that was introduced in 1957, we saw for kanamycin that most of the strains were either resistant or intermediate. In fact, all of them were, versus if we look at gentamicin, where we see several strains that were not resistant to gentamicin, and gentamicin was introduced in 1963, versus amikacin, which was introduced in 1976, and only 1 of the strains were resistant to amikacin. The same thing was true for beta-lactams, so the penicillin-like antibiotics. If we look at ampicillin, which was introduced in 1961, all of the strains were resistant. If we look at, for example, ceftriaxone, which was a 3rd-generation cephalosporin that was introduced in 1984, only 5 of the isolates were resistant. Whereas if we look at carbapenems like ertapenem and meropenem that were introduced in the mid-1990s, we didn't see any of the isolates that were resistant to this antibiotic compound, which is maybe cause for cautious optimism because this is a last resort antibiotic, and it's very important to see that in these wastewater treatment E. coli samples. None of them were resistant to carbapenems, but of course it emphasizes the need that these antibiotics, carbapenems, should not be used unless really, really required. Otherwise, we expect to see a similar trend where over time the bacteria will become more and more resistant to carbapenems as well. Now, like I mentioned, we sequenced two of these isolates, the two most multi-drug resistant isolates, 32 and 68. And we can see that each one of these isolates had a chromosome of about 4.5 to 5 million base pairs, okay? But they also each had 3 plasmids, 2 large plasmids. In isolate 32, they were both about 50,000 base pairs. And in isolate 68, there was a very large plasmid of about 124,000 base pairs, one of about 107,000 base pairs, and then another small plasmid. What was interesting for this plasmid in isolate 32 and this plasmid in isolate 68 was they both had a very, very large number of antibiotic resistance genes, conferring resistance to many, many different antibiotic compounds, as we can see here. So a really broad spectrum of antibiotic compounds, several genes on each of these plasmids. And what's very, very interesting is we saw a very, very strong correlation between the genotypes on these plasmids and the phenotypes that we saw when we did the antibiotic susceptibility screening. So this is very worrying because one single plasmid can transfer resistance to many, many different antibiotics. What's even more alarming is, although we didn't see any genes associated with carbapenem resistance, and if you remember, none of the isolates were resistant to carbapenems, we did see on similar plasmids. So we found that there were a number of plasmids that shared the same backbone as plasmids from isolate 32 and isolate 68. Some of them shared the same genes, but others had additional genes like this KPC2 and this NDM5, New Delhi beta-lactamase 5. And both of these genes do confer resistance to carbapenems. And we see this kind of like a cell phone. So the plasmids are sort of like the cell phones, and the genes are sort of like apps. And we know from our kids that they're always introducing new apps and maybe taking out new apps. And these are kind of like the antibiotic resistance genes. And once we have the cell phone, it can import lots of different apps. And so once these plasmids are in the environment, they have the potential to uptake these antibiotic resistance genes from various mobile genetic elements like integrons and like transposons, insertion sequences, etc. And this makes these units very, very dynamic and questions the capacity for introducing new antibiotic resistance genes in the future. Okay, we're going to jump now to a completely different study, which was conducted by Roberto Morano, a PhD student who just submitted his PhD. His work was published not too long ago in Water Research, as we can see here. And Roberto, in contrast to Tamar, used a completely culture-independent method. So instead of isolating bacteria, we took water, soil, crop samples, extracted DNA, and then used quantitative real-time PCR to assess the abundance of different genes in the samples. We looked at the 16S ribosomal RNA gene, the integrase gene. 16S is a proxy for total bacteria abundance. INT1 is a proxy for class 1 integrons, which often harbor antibiotic resistance genes, even though they don't confer resistance to antibiotics themselves. QNRS, which is a plasmid-associated quinolone resistance gene. And then we looked at 4 beta-lactamase genes, 4 genes that confer resistance to beta-lactam antibiotics. TEM, which is quite common, CTXM, which is often associated with clinical pathogens, and OXA and JES, which are also associated with clinical pathogens, but are found to be very, very abundant in treated wastewater. And Roberto looked at many, many different samples. He looked at specifically 4 wastewater treatment plant effluents that were used for irrigation. He looked at different soil types and a number of different crops like corn, potatoes, cabbage, parsley, etc. And in some cases, we had lysometer experiments and experimental orchards where the soils and crops were irrigated in tandem with either treated wastewater or fresh water. So all of this was put together, and it's a lot of data, and I'm going to summarize it quite briefly. First, looking just at the water, okay? So if we look at the effluent samples, so the samples from the treated wastewater, from the wastewater treatment plants that were used for irrigation, and compare them to the freshwater samples where we had freshwater irrigation, we can see that there's significantly higher abundances of these antibiotic resistance genes, and these are in copy numbers per milliliter, in the effluent, so in the treated wastewater versus the freshwater used for irrigation. So DNQ stands for detectable but not quantifiable, ND stands for not detectable, and so significantly higher numbers obviously in the treated wastewater. And if we take these numbers and translate them from copies per milliliter to daily loads of antibiotic resistance genes entering the soil in copies per meter squared of soil, we'll see that for most of these genes, we have a huge amount of copies that are going into the soil, potentially contaminating both soil and crop. And this is maybe a reason for worrying regarding the transfer of antibiotic resistance genes. So obviously the next step was to use these methods and not only look at the water that's being used to irrigate, but also look at the soil and the crops that are being irrigated. And surprisingly, when we look at the soil and the crops, almost everything here in red are values that were either below detection level, BDL, or detectable but not quantifiable, okay? Now, what was really, really interesting in both soil and crops is we saw no real correlation between gene values that we saw in the water versus the gene values of the crops in the soil that were irrigated with that water. So we could see a very high level of antibiotic resistant gene in the water, but the soil that was being irrigated didn't necessarily have a higher number of gene copies than soils that were irrigated with lower lower loads of antibiotic resistance genes. So we saw this, again, a sign that was quite promising, and it indicated that we have soil resilience. The ability of a soil to resist or recover their healthy state in response to destabilizing influences. In other words, even though we have these intruders, whether they be the bacteria or the genes that are coming from the wastewater, the fact that the soil microbial community is so robust, it does not allow, due to the resilience, these foreign bodies, whether they be foreign bacteria or foreign genes, to colonize the soil. And we saw the same for the crops themselves. And we saw this as an indicator that soil is an ecological barrier to dissemination of antibiotic resistant bacteria and antibiotic resistance genes. But we thought about this BDL, below detection limit, or detectable but not quantifiable, and this caused Tamar to do this very, very intricate microcosm experiment. You all remember isolates 32 and isolates 68, which are these multi-drug resistant E. coli strains that come from effluents. So these are strains that are actually going into soils. We used both a high concentration and a low initial concentration. And Tamar irrigated these microcosms. We looked at clay loam soil, but also at a sandy soil. And she tried to see how these organisms survive in the soil over time. And what we saw was that at both the high concentration and the low concentration, between 8 and 28 days, these bacteria rapidly demised. The abundance went down until reaching below detection level concentrations. But then Tamar did something else. She actually enriched these bacteria using rich media, incubating them overnight for 8 to 10 hours. And then she did the same plating on these selective plates, which I didn't mention, that only isolate 32 or isolate 68. They don't isolate any other bacteria. This was tested. And what we can see, to make a long story short, is in the case, for example, of low concentration of isolate 68, even though it disappeared after 14 days, and for 14 days it remained in the soil at below detection concentrations, when we enriched this bacteria, it rapidly regrew. In other words, many of these strains may be able to persist in soil at below detection level concentrations, what we call under the radar. And a big question that occurred that came up was, do these below the radar concentrations pose some sort of epidemiological or problematic effect if they do encounter rich environments? And to test this hypothesis, we looked at a number of different samples, a number of different experimental settings. I'm going to focus on these lysometers, which had lettuce in a very sandy soil, irrigated in tandem with either freshwater or treated wastewater. Now, the experimental setup was such: we had freshwater irrigation, treated wastewater irrigation. We directly analyzed these soils and water samples using Chrome-Agar, which specifically was looking at Enterobacteriaceae that were resistant to third-generation cephalosporins, known as ESBLs, or carbapenem antibiotics. And we also used quantitative PCR and metagenomics to look at the soils directly. But we did the same enrichment step as Tamar did, and we did the exact same type of analyses after enrichment. And again, everything in red is the lysometer experiment. I'm not going to explain the other results due to lack of time. So here is the culture-dependent studies looking at ESBL producing Enterobacteriaceae and carbapenem-resistant Enterobacteriaceae. The yellow are the enriched samples of freshwater irrigated soils. The red circles are the enriched samples of treated wastewater irrigated soils. And what we can see for both of these bacterial types is higher abundance of resistant strains in the enriched treated wastewater irrigated soil sample than in the enriched freshwater irrigated sample. And even though we didn't see any effects when we directly looked at these type of bacteria from the soil, after enrichment, we do see an effect. So again, we see this below the radar type of effect, and these are potential pathogens, so it's very, very important to look at them. We did the same thing using culture-independent metagenomic analyses. And just to take you through this NMDS plot of the microbiomes, we look at the 3 treated wastewater samples, and we look at the soil samples. And again, I want you to focus on the freshwater irrigated soil sample and the treated wastewater irrigated soil sample from the lysometers. And you can see that they're very, very closely related to each other. Each dot here is the entire community of the freshwater irrigated soil and the treated wastewater irrigated soil. But then we did the enrichment, and what we can see is a huge divergence in these populations. So again, the blue are 3 replicates of the freshwater irrigated soils. They group together very, very closely. But if we look at the enriched treated wastewater irrigated soils, we see a completely different microbiome. Again, they're very similar to each other, but they're very, very different than the freshwater irrigated soils. And again, this shows that even though we didn't see any or very little difference when we look at the soil directly, when we enrich the sample, we see a huge difference. The same thing is true when we look at the metagenomic data and try to extrapolate the antibiotic resistance genes. I won't go into all the details. I just want to focus on these 2 figures here. First of all, if we look at the total antibiotic resistant gene richness, we can see that there's much more, significantly more richness in the enriched treated wastewater irrigated soils than in the enriched freshwater irrigated soils. So again, more antibiotic resistance genes in the treated wastewater irrigated enriched soils. And if we look and say, who are these antibiotic resistance genes associated with? When we look at the enriched freshwater irrigated soils, they're mostly associated with bacilli, as we can see here. I hope you can see my arrow, okay? But when we look at the enriched treated wastewater irrigated soils, we see very little antibiotic resistance genes that are associated with bacilli, but we see many genes that are associated with Enterobacteriaceae, like E. coli, for example, okay? We see many genes that are associated with Moraxellaceae, okay, which are associated with certain bacteria, like Acinetobacter, another known pathogen. So again, the enrichment is causing a shift in the dominant bacteria that are harboring antibiotic-resistant genes. Okay. Now, I won't go into all of these studies, but to make a long story short, both Enterobacteriaceae, the Moraxella, are associated with gamma proteobacteria. And we believe that gamma proteobacteria are strongly associated with pathogens in clinical environments. Gamma proteobacteria are also well known to be associated with horizontal gene transfer of antibiotic resistance genes. And we believe that these gamma proteobacteriaceae, these gamma proteobacteria harboring these three families, primarily these three, as you can see here, are strongly associated with transfer of antibiotic resistance genes. And this brings us to our copiotrophic hub hypothesis. Copiotrophs are bacteria that grow rapidly in rich media. And we believe that the copiotrophosome represents these types of bacteria that are enriched when they come into contact with rich media. We believe that the soil copiotrophosome is a hub for inter-environmental horizontal gene transfer of antibiotic resistance genes. We believe that gamma proteobacteria are the most epidemiological relevant fraction of the copiotrophosome due to their strong association with disease and their capacity to acquire and donate mobile elements. We believe that the copiotrophosome facilitates transfer of anthropogenically derived ARGs from wastewater, manure, etc. to soil. So if we have these anthropogenic sources like wastewater and manure, and we put them in soil, these basically have the capacity to be transferred. The copiotrophosome can potentially facilitate transmission of novel ARGs from soil microbiomes to human and animal pathogens. And we believe that anthropogenic activities can stimulate copiotrophic bacteria and thus potentially enhance the potential for inter-environmental mobilization of antibiotic-resistant genes. And just to make a long story short, if we have these gamma proteobacteria that are entering, for example, a rich environment like the gut, they can not only proliferate, they can also transfer their genes to other bacteria. Now, right now we see this bacteria is relatively small in the soil environment, but if we expose the soil to anthropogenic pollution like manure, like wastewater treatment, this fraction of gamma proteobacteria is going to proliferate. The fraction that can potentially enter rich environments like the human gut will also proliferate, and the capacity of these bacteria to either cause infection or to transfer antibiotic-resistant genes to native gut bacteria is also much, much higher. Again, this is very preliminary, and obviously we need to do a lot more research to see if this holds water, but I think it's a very, very interesting concept. And with that, I would like to thank the students who participated in the research, the Ministry of Health, who helped us a lot with the field sampling, our European partners, and the funding agencies, the Israeli Ministry of Agriculture, and PRIMA, which is part of a European framework for wastewater treatment, irrigation, and analyzing effects. And with that, I'd really like to thank you again for participating. And again, if there are questions, if it's possible to contact me directly, that would be great. And if not, I'd be very, very happy for you to contact me via email. Thank you very much and enjoy the rest of the symposium.
Hello.
Hello. Yes, sir.
Now, audience, you are requested to keep your question at the last of this lecture, because right now Dr. Citrin is offline, and Dr. Vijay Tripathi will let me know about the next speaker, and then I'll.
So there is one correction. Dr. Dhiraj Sinha will speak before Professor Pratyush Shukla. So, sir, just introduce Dr. Dhiraj Sinha, our next speaker.
Okay, Dr. Vijay Tripathi. Dr. Dhiraj Sinha. Dr. Dhiraj Sinha is currently postdoctoral fellow at Aix-Marseille University, France. His area of interest include molecular modeling and simulation, calculations, and genomic and metagenomic data analysis. Dr. Sinha did his PhD in biophysics from the University of South Birmingham. Can you hear me? Hello.
Yes, sir.
Oh, Czech Republic. He got his PhD fellowship during 2010 and 2000 from the Czech Science Foundation, which is a very prestigious one, and the grant agency of the University of South Romania. And till now, he has published many research papers in a very prestigious journal. That is Journal of Physical Chemistry, Journal of Molecular Modeling, and so on and so forth. So, Dr. Dhiraj, please start your lecture.
Yeah. Good afternoon to all. Am I audible, sir?
Very clearly. Please.
Yes,
go
very
ahead.
clear, Doctor.
Very clearly.
Yeah,
go ahead with your lecture.
Yeah. Yeah. Okay. So, can I start now? Yeah.
Please.
Yeah, it's a great pleasure to be here in this online webinar. And first of all, I am very thankful to the organizers who give me an opportunity to have present some of my work, which I am doing in Aix-Marseille University, Marseille, France. Most important because it's really very emotional moment for me to present something in front of our mentors, in front of your alma maters, because in two from University of Allahabad, and at that time Professor P.N. Pandey was introducing me like as a mathematics, and at that time I was very surprised that how mathematics is also useful in biological handling the biological problems. Nevertheless, the journey is too long, but overall, the last time Professor P.N. Pandey requested me to just give the lecture, but unfortunately, I am back at that time from India. But I promised for the next time. And so thankful again, Professor P.N. Pandey, that he just started from 2002 up to now. He continue his blessings. And most important, this time the organizer is Professor Vijay Tripathi. He is very much like a close friend to me, and give this time that I should prepare and I should deliver something which may be. So the topic, can I share my slides? Yeah, my slides is visible to all.
Yes, it is, Dr. Sam. Usko full screen kara diye to acha rahega, sir. Thank you, thank you.
Yeah, it's already done. So the topic of my presentation is a pangenome analysis and virulence profiling of Streptococcus intermedius through NGS data. I will come to this point, but before, because my objective is to address the general audience who is from the different stream, from the biotechnology, from the biochemistry, even some are from the engineering background, very versatile. So I would like to go for the very basics, and then something which is particularly interest of my work, which I'm doing here, and then most recent results which I got recently. So if for the bioinformatician, if you see that on the left hand side, you see the image, and because all information like is stored in the sequence of the, which is like in 1950s, it was like reported by the Watson and Crick. But later on, we gradually with the help of technologies, with the help of all equipments, somehow we are able to explore more and more, and then say that, okay, this all beauty is inside this all combination of between this just 4 residues, which is like A, T, C, and G. So for the general audience, okay, this is just residues, but for us, it is our raw material, and we just very much interested that how this all the information to code for a particular whole organism is stored in this DNA sequences. So because if we from the advent of the different level of the technologies, we just see that how our recent advancement takes place, and from which is known NGS data, which stands for next generation sequencing data. Here, I just mostly addressing the whole genome sequence data. Apart from this, there is RNA-seq data is also, which is like the combination in the RNA, and there is epigenomics. What we exactly do with the whole genome, that we analyze different variation, different point mutation, and what is like particularly more and more focus with the genes, and then finally, which is like at the functional effect of the mutation if it takes place, and a different level of analysis is possible with the whole genome sequences. So at the final application, which is like the clinical application, because right now we are objective that, as we hear in the previous lectures, there's the personalized medicine, and then from the Israel that you see that all is like genomic data is very much now come in the play, which gives an ample of the information to say that, okay, we have dig something more from the last 10 or 20 years. If we stand for the what is the meaning of the NGS data, which is started from the 2005, and as I told you that I started in 2002 with the bachelor's in applied sciences, and at that time, if who is come from this stream is like the Human Genome Project, which is the aim is to sequence the whole human. Different drafts are released by the NIH. And at that time, we are just very surprised that, okay, is it really? We are in that level from starting from the Allahabad that, okay, we are just going to deal. And that was just like a dream at that time that, okay, we are just very much updated, because of our objective is at that time that we represent ourselves as much as possible to the current scenario. Later on, because you see that at the different advancement of the technology, from the very much simple genome sequences of the small bacteria to our aim is to switch to the whole genome of the human. So there is a different technologies involvement, and by the and then we are able to sequence the whole genome of a particular organism. So we just name it with the next generation sequencing, because it's still our objective to make a complete genome in one stretch is still not achievable. So gradually with different reads, which is like here, if it is the flow on like the NGS data analysis workflow, the library, the clonal application, and then analyze the data, and with the primary data and the secondary data, which is like the started from the raw material, and then gradually more annotating takes place, and finally we are able to say something more from the raw data that oh, this is the beauty of these combinations of the ATCG, which makes the expression in that level that this particular strain. I'm particularly focused here with the microbiology data, but okay, but all the things comes in this way, which is started from the microbiological way. So if we here on the left hand side, you just see that how different level of sequencing from the prokaryotes to eukaryotes, and then there is exponential increase of the data stored in the biological databases, and then the work from the bioinformatician comes into the play, because this sequencing method started from the Maxim Dilpert and termination method, and now different sequencing method has been evolved with more sophistication. But what we should do with this data, we have to analyze, we have to annotate. The more sophisticated word, we could say that how beautifully annotate these biological sequences to retrieve the information from this combination. From the eukaryotes particularly, I just here you just see that we are more focused with the bacterial world, and in the bacterial world, if you saw from the bacteriophages, from the viruses, which is like now the world scenario is changed after the introduction of this SARS-CoV-2 viruses, and then different level of analysis. But right now, up to now, even then, with this all the technologies, we dig a very small section unknown, that we have some data which is available. So if you go with the history, takes place in 1995 when the first strain of the Haemophilus influenza is. We have now the exponential lots big data set is available, and appears this NGS sequencing methods. I hope lab like the IHU, you just see that the up analysis. Particularly here, I am doing the taxogenomic analysis. Taxogenomics, am I audible, sir? Hello.
But your slide is not visible.
Your slide is not visible, and there is some problem from your side.
Yeah.
Network connection.
A poor connection. Because of the poor connection, you know, there is an interruption in the internet.
Okay. And now it's fine, sir?
Now it is okay.
No.
My slide is.
No slide.
Yeah. So from the yeah, little bit give the historical background of this.
Dr. Sinha,
not visible.
Dr. Sinha, your slide is not visible.
You just share the screen. Your slide is not visible.
Is it okay now?
Now you are visible. Your slide is not visible.
So now it is visible now, the slide is?
No, no.
No, sir, it's not visible as of yet.
Not yet.
वो स्क्रीन शेयरिंग करिए डॉक्टर सिन्हा जी.
Yes, sir, ये screen shared है, but nevertheless I should do again. Okay, wait.
Dr. Tripathi, Dr. Wesley, could you help Dr. Sinha so he can screen share it? Yes, it's coming. It's coming now. It's coming now.
Yeah, give one
yes,
second.
Sir, it's available. Dr. Sinha, it's available now. Thank you.
That's great. Yeah, it's okay now, sir.
It's okay.
The slide just giving the little bit background, focus with the definition of the pangenome. that if you remember who are just from the biological side, that the classification of the particular species is also a very great objective from the the very beginning. And initially with the bacterial strain, we just classify on the basis of morphology, then how it's oval shaped bacteria or it's rod shaped bacteria, and then we have some particular chemical testing that this bacteria is very much sensitive with this particular agent of the chemical. And then with the advent of the sequencing method, we are just gradually switch from the classification on the basis of morphology and the biochemical testing to the 16S RNA. Why 16S RNA? Because it is like the signature of the particular strain which is present in all the strains. So we should just check, is there any variability comes in the 16S RNA gene. And from the 16S RNA, we switch with the GC content, what is the guanosine and cytosine, because these are the very much critical parameters to classify the bacterial strain. And then with the DDH method and all, with the whole, we find out that, okay, now from 1872 to the 2016, with a different level of data or parameters available, we are just with the different technologies, we are able to classify better and better and more precisely the strains of the bacteria. So if with suppose we from the very basic, if extracted from the sample and then sequencing, and then what exactly come into play, that how we just define a particular genome, that should it belong to the known data set, or it is new strain, what in case of the complex bacterial, which is I am dealing now, and the other is with the experiment with the culturomics, doing the different labeling of the straining and all experiment, which I am not very familiar, fairly to say, from the very beginning, that to doing something more in the wet lab. So overall, suppose if we have a particular strain, how we define a particular species, then the known data sets which we have make our own in the taxonomic world, that how it belongs to the new species or not. So we have more than 1.5, then we can say it is a putative. It is a putative strain which comes from the new which is not known up to the data either in our lab or in the worldwide lab. After like if we go with the 16S RNA, after data, we just analyze the 16S RNA sequence data, that if the sequence similarity less than 98.7, like the new strain is less similar to the known data set of that particular species, then maybe it is putative new species. After that, we just go with the, if it is putative, then we go for with the ORFs, GC content, and I will show you all. The other possibility that we could do the phenotypic characterization with the antibiotic susceptibility, which is like not my area, but definitely I have the known data, known like results of the phenotypic characteristics from the wet lab, that okay, these are the results from your sequences. So the basic flow chart that how, if we now just dealing with the Illumina sequence, now the nanopore sequences are also available. These are the different level of the technologies which gives the more and more precise and accurate sequences. Particularly right now, I am focusing with the Illumina sequences. After the sequence, raw sequence come from, we just define as a read. Reads are like the different stretches of these to assemble these stretches, and then to make a one molecule. To after like the assembly, we use the A5 or A spades. There are different assembly tools. We just finish it with a more better more and more remove the bad quality of the sequences with the different quality check softwares. And then we just have like the pipeline, which is like a PROCA is a one pipeline, which is known as annotating pipe categories of the whole in terms of how much the genes are, which genes are coded, and what the proteins are coded from the whole genome. And after that, we just have to, our objective start to compare the known data set, to compare the new data set with the known data set. That is like my experience, like from the very through now, what we are doing is just in defined in one words, that is known as comparative genomics. We are just doing the comparison, nothing more, and that is our objective. After that, we just have the different databases. We can define the virulence factor. We can define there is any plasmid is available in that data, which is very much important to report, like the horizontal gene transfer, which is very much described in my previous lectures also. So after, like, this is the basic flow chart we could do. We define the one species, we could define the one strain, very much good annotation with this pipeline. But what we could do, if we have the strain of the same species, then we have like 50. Now in the case of COVID, you have like the 1,000 or even the millions of the strains are available. So how our objective is to compile holistic approach to give something which is comes from the all the combinations, which is comes from the all the data set, that something is now from the one strain. I just switch with the particular example of my presentation, that is pangenome, and I will define exactly what is the pangenome is. Pangenome, if we want to define, this is like something very core genome, which is available in all the strain. And then there is a unique genome, unique genes, which is come in the, like the strains are available. And there is another, like the accessory genes, which is only and only available in few in circles. Then the big circle is defined as a pangenome. Here I am just giving an example of the Streptococcus intermedius, which is we just take the 27 strain and like the 14 strain from our own lab, and then the remaining, like the already known in the databases, we just take all the strains and try to retrieve some information from all the 27 strain of the Streptococcus intermedius. So if the like how why we are just much responsible from, especially the brain abscess is, and there is a like liver abscess, different abscess is like comes from abscess formation. Just want to specify that there is a particular view responsible of different kind of the diseases, which is known as the abscess. So particularly like from the if you go with the disease, there is a pathogenicity, there is a toxicity, and there is a virulence factor which is responsible. And we just like the intermediate antigen for like, which is very much play a key role in the survival of the Streptococcus intermedius strain. For all I know, these are all the reported like the strains, half are from my own lab databases. We just go with the different coding sequences, tRNA, and just want to like at the first level, we just want to quantify as much as good that come from this screen. So if we go with the basic data set that we have, like the 26%, and then transfer RNA, and then how much RNA, and overall you just see that how is like the prophages, which comes like very much their role now, gene transfer, how much they are numbers. Till now, we are focusing up to the numbers, that how much, which kind of different genes and at which numbers they are available in the different strain of the Streptococcus intermedius. So at the first level, we just, if we have this quantification with the numbers, then let's come in the role of the bioinformatician, how they check it out. At the first level, after doing the comparison, we just see that origin of these all strains. And then this is based upon the 16S RNA, which is like the very signature parameter to classify. I already told, and you just see that all the clades with all the strain of the 27 lies on the same clade, and then strain which comes from the SAG group, like the Streptococcus aureus and the different classes of the Streptococcus. And here you see the 16S RNA based phylogenetic analysis. After that, we just, with the different databases comparison, we just find out the resistance gene, virulence gene, and after all, the most important, like recently, if you are focusing with the, comes from the CRISPR-Cas system, and from the very beginning, we are very much interested that how much number of the CRISPR is available, which is very much play in the different, now the new work type 1 and type 2 authenticated by giving the Nobel Prize to the lady just reported work from the on the CRISPR-Cas system. So overall, if we just overlay all the 27, how it looks like, what exactly the genes are, what is the coding different genes is available. This is like the circular representation with the annotated genes of the 27 strain of this. At the next level, we just focus on like different categories of the gene. Like we are just with the databases, and we just classify how these all 27 strains are comparable and which are the genes which are present in the numbers of the different strain, and just to compare whether we find this they are differently associated with the number of the categories of the orthologous gene or not. And here on the left hand side, we just particularly here we are just after 16S RNA, we just take the core genome, like at the next level of the 16S RNA, we just take the core genome from the 27 strain and just compare that, because the core genome is present in all the strain. So do they are differently, variability exists at the core genome level of the 27 strain or not? And up to now, like we just these parameters, we just say, okay, there is not much big difference in all the strain based upon the core genome. After all, like because the title stands for the pangenome analysis, and here, if we go with the core genome analysis with the number gradually with the increase of all the strain that incorporate the other genes from the different species or the different variability genes, and that is why like if we define this as an open genome, pangenome, or the closed pangenome, and from this analysis we just say that the Streptococcus intermedius strain or the species have the open pangenome model. What exactly the meaning of the open pangenome? That the genome itself is still able have the capacity to acquire the new genes, which makes the different new strain all. And because our objective at that time is that, okay, there is different classes of the abscess formation, that the liver abscess formation, there is a brain abscess formation, there is abdominal abscess. Do we have all the reported virulence factor? They have some sort of the association with the different classes of the abscess or not? For that, we did the principal component analysis. And with the principal component analysis, we are very much, because if we go with the statistic, definitely it is difficult with the handling with the like huge data set in principal component analysis. We just take the few strains, a few virulence factor, and try to classify it on the basis of different association, and somehow we are successful that genes are associated with the different strains. So at the next level, we are just out of time maybe. So from the if we have the different strain from the one species, do all the taxonomic what exactly the reported from the 16S RNA or from the morphological characters, do they are already reported correctly or not? We could check it on the basis of core genome, on the basis of whole genome, and then these are the how the classification of in the microbial world takes place on which is basis on the core genome and the whole genome. Remember, we just do some reclassification of the reported species, that whether they are correctly reported or not. Some of the example I can give you, but with the lack of time, I just end in the conclusion with a different virulence gene, which is classified on PCA, that they associated with the different abscess formation, and the lots of things are still need to dig from this all the combination of the gene. So this is all the concluding remarks, but the take home message, because I just said that okay, there is a from the who know the very much DNA is coded for the RNA transcribed, and then there is a protein, DNA, RNA, and protein. So the same which we feel in the bioinformatics world, that the sequence is responsible how the structure is, and the structure is responsible how the function is. So there is a central dogma in the bioinformatics is also exist, from sequence, structure, and function analysis. And luckily, as I have little bit experience with the structural analysis also on the protein. So at the next level, I can say that still the best is yet to come. These are the manuscript which I'm just have as an author, co-author, and as a first author. Recently, some are submitted, some are in the pipeline. And at the end, I would like to acknowledge my institution, my funding agency, and I hope you know this very much. This Didier Raoult, which is very much who introduces hydrochloroquine after the pandemic situation with the COVID-19. And then my current boss, Professor Fournier, and luckily at the end, I can say that I am some sort of very much lucky that I find a good colleague as my wife too, Dr. Mudra Khare. And if we talk, because everyone is now, we are here because of the COVID, otherwise we just meet physically. So if we just very much interested how now we are dealing with the different strain at the first level, here you see that how phylogenomics can be, we are using to find out that the different strain from the different patients, and do they are differ with each other. There are some initial results from our recent manuscript of the COVID strain, because this era is very much affected with now the time to deal with this, and our lab and Professor Raoult and our whole group is doing drastically intensively to dig something more to report and how better we just make the world. So these are the different strain from the different world part of the world. Do they differ? And then from now up to say that the second wave of the COVID is more rigorous in the Europe, because there are combinations, there are the new combination permutations, which makes the variability very much, which have no any association in the first wave of the COVID-19. At last, I would like to say thank you very much, and thanks for your attention, and I am ready to address few of the questions if anybody has.
Thank you, Dhiraj. Your topic was, very, very good. Pan-genomic analysis, virulence profiling. But because of the poor internet connection, only partially could be heard. It was just like old radio station. जिसमें एक तरफ पहलवानी का रहा और दूसरी तरफ एक खाना बनाने का रहा, इसी तरह कुछ सुन रहे थे और कुछ बीच में मिस कर रहे थे, बहुत काफी चीजें मिस हुई, बट nevertheless it was a good lecture. A couple of questions can be addressed our audience. You are requested if you can ask a couple of questions only, 1 or 2 questions, and then after that. Hello.
Thank you, Dr. Sinha. I have one question.
आवाज जा रही है?
Yes, sir.
It's a very good work, and you tried to make a tree, evolutionary tree, based on the sequences, right? Based on the sequences, overall sequences.
Yeah.
But if you see the pan tree concept is also based on measuring some distances like Jacquard distance, Manhattan distance. So have you tried using those distances?
For we just using the first method of the maximum likelihood method to define the phylogenetic distances with each other. Sorry, methodology.
Yes.
Of course, there are different way of. I think I should finish first. Different way of calculation of the distances, but I just started with the UPGMA distances, like the unpaired, and then switched with the statistical, more probabilistic approach, that is the maximum likelihood method, to compare the distances. And luckily, in that, this particular set is defined very well with our maximum likelihood approach.
Yes, you can use maximum likelihood for sequences, for sequence analysis. But when you go for pan tree is based on the distance. So your sequence is having core gene, your sequence is also having some singleton gene, accessory genes.
Yeah.
So if you want to understand fully, you can measure the distances. And I wrote one book chapter for Elsevier. I think you just search pan genome, you will find that chapter where I talked about evolutionary pangenomics. So
yes,
you get some idea how to measure this Manhattan distance and Jacquard distance.
Yeah, it would be great to read this particular chapter, sir.
Okay, thank you so much, Dhiraj. Dr. Bijay, who is the next speaker? No?
Sir, our next speaker is Professor Pratyush Shukla.
Okay.
Sir, yeah, just introduce Professor Shukla. Yes, sir.
So thanks to all to give this opportunity from sir. Sabhi ko sadar pranam.
Okay, Dhiraj, okay.
Okay.
Professor, hello.
Hello, I'm audible?
Yes, sir. Yes, sir.
Okay, namaskar.
Namaste, sir.
Namaskar, Dr. MP Singh, Dr. Dhiraj.
Pranam, sir.
अरे नमस्कार कहाँ है, जरा कैमरा पे आइए।
कैमरे में आ चुके हैं सर।
तो कहाँ दिख रहा है?
वो डॉक्टर साहब दिख तो रहे हैं, वो असल में वो उन्होंने स्क्रीन शेयर किया है तो साइड में दिख रहे हैं डॉक्टर साहब।
और नहीं, अब तो हम आपके पास हैं, हम आ जाएंगे वैसे ही देखने आपको।
नहीं आना ही पड़ेगा, आपने मुझे बताया नहीं।
अब आपके पास कभी भी आ जाएंगे।
अरे डॉक्टर साहब, remember this is an international conference. There are people from all over the world. They will not understand us in Hindi.
Okay.
Thank you, sirs. Thank you very much.
Yeah. We have to speak in our some local language also. Okay. So that we should also interact in our way.
Okay, colleagues, friends, and dignitaries from all over the world. Now I'm going to introduce my colleague, my friend, Professor Pratyush Shukla, to the audience. Professor Pratyush Shukla is presently working as a professor at the School of Biotechnology, Banaras Hindu University, Varanasi. Prior to, am I audible? Hello?
Yes, sir.
Prior to joining BHU, he was working as professor and head at the Department of Microbiology, Maharshi Dayanand University, Rohtak. And right now he is on Lyon. He was awarded the Indo-USA Research Professor. He has been recently appointed as a visiting guest professor in the South China University of Technology. Professor Shukla recently received DSc in microbiology from Barkatullah University, Bhopal. And I'd like to share here one thing. When he got registered for the DSc, I was one of the experts there, isn't it, Shukla, with Professor Shukla? And he did his PhD in microbiology from the medicine faculty, APS University, Riba, in 2002. He was awarded with NRF, the postdoctoral fellowship, during 2008-2009 in enzyme technology at Durban University of Technology, Durban. His research areas include enzyme technology and protein bioinformatics. He has 18 years of research and 20 years of teaching experience in the reputed University of India and abroad. He has written more than 27 book chapters, 1 patent, published more than 150 peer-reviewed publications in the reputed SCI journals. He has carried out more than 12 R&D projects funded by the national and international agencies as a PI and co-PI, including the prestigious Erasmus grant by the European Union. He is Fellow of National Academy of Agricultural Science, Fellow of Academy of Microbiological Sciences, Fellow of Biotech Research Society of India. He has received several awards, including Professor S.V. Saxena Award, and not many, at his credit. He is also serving as the editor in the Indian Journal of Microbiology, Scientific Reports, academic editor of PLOS ONE, editor BMC Microbiology, editor Protein and Peptide Letters, and editorial board member and reviewer in many journals. He also served as General Secretary of Association of Microbiologists of India for 2 terms, for 2014 to 2020. Now I invite Professor Pratyush Shukla to deliver a lecture. Professor Shukla.
Okay, good evening to all of you, and thank you, Professor MP Singh, for your introduction. I am your colleague, your friend, and just learning with all of you. And first of all, I thank you all for inviting me, and a special thanks to the organizing secretary, Dr. Vijay Tripathi, who is always doing all these good activities. And I can see the colleagues like Professor Rubina is there, and Professor Jonathan is there. So all my colleagues are here. So I am very happy to see all you virtually here. So just not wasting much time on that, coming to the Are you able to see the screen now?
Yes, Dr. Saab.
Okay, so just a brief introduction about the topic first, because this is, I have made it accordingly so that it match with the theme of the conference, which is bioinformatics, biochemistry all together. The only thing which I can say you is that it is all the complete introduction which I want to propose it here. So the topic is futuristic ideas for biocomputational and systems biology approaches in microbial biotechnology. If you talk about enzymes from the environment, you get a lot of enzymes, but the main concern is how to find a good regulatory mechanism understanding, and also Professor do the Shukla. Enzyme. Excuse me.
Your slides are not front.
Now it is coming.
It is not in the front. It is in the one of the corner, right corner below, and not visible.
Dr. Vijay, can you adjust it or I have to adjust it?
No, it's fine. It's fine. No, it is visible.
It is okay, sir. It is okay, sir.
It's
Visible,
fine.
sir.
No, visible. Right.
Okay. Because in online system, we have to just see that how we can resolve all these things. Anyway, sorry for the inconvenience. So I was talking about that we get a lot of enzymes, lot of microorganisms. The only thing is that once we get a desired strain, it is difficult to get it modified, or it is almost lot of time is gone when we screen one enzyme and then go for the complete utilizing that particular enzyme. So I will just give you some gist of this, that microbial biotechnology or sustainable microbial biotechnology is based on all these aspects. So we have covered this few aspects in this presentation. One is that how the novel platforms for different enzymes can be used, especially with concern with the therapeutic applications, also substrate specific modeling, then also the biosynthesis of these enzymes, and also how systems biology and protein engineering tools can be used. So if you go further, microbial systems biology, it has a lot of avenues, but I will not be able to cover all the avenues in this presentation, but few of the avenues I'm covering here. That if you see, this is industrial systems biology, where you need to do all these aspects together to get a better approach or to better understanding. So if you want to get any enzyme, you have to do the genomic studies, you have to do the high throughput sequencing technology use, you can also do the kinetic modeling, you can also do metabolic engineering aspects. So all these aspects together cannot be done by one person. So there are so many collaborations when we do. So the main message for this is that this is telling you the whole complete story, which has been already adopted by various research groups. So if you see, this is a simple mutation, you can see that we get a 20-fold increase. So we have in our lab, we are working on these different types of scaffold of metagenomic analysis of the data. And if you see, these are the different softwares which you can use, like functional category, you can use Megatrap. For taxonomic, you can use Mother MLST. For clustering, you can use Galaxy, Megan, Camera. For pathway analysis, this is a very important tool. And these days, the metabolic pathway analysis is coming up in a greater way. So you need to see whether you want to get hold of this pathway engineering or not. So this is a very important aspect which you need to cover, and also see whether you are able to get all those pathways understanding to your need. The second aspect which we want to cover is the, I'm audible?
Very clearly. Very
okay. So when we talk about, I think my slides are not moving. Just hold on, I think. Okay. Now, if you see, this is a systems biology as an approach for deciphering microbial interactions. In this paper, we have described all those small and bigger aspects of interactions, because most of the activities of the microorganisms are due to these interactions. So when you talk about microbial interaction, it is not only related to the plants and animals, it is also related to various metabolic applications of these interactions. So when you talk about molecular dynamics simulation, I need not to brief about it. You need to do the kinetics processing, protein folding studies, and also various type of modeling. So I'm just presenting few of the case studies. This is a HMGCR enzyme, which we tried to model together. And here we try to see the various HMGCR from isoforms from Homo sapiens. So we did the kinetic modeling as well as the structural modeling of this isoform 2, and we did the validation as well. So we also tried to see that how these SMGCR are interacting with various type of statin therapy. So we came to know that these isoforms too have very good understanding and very good interaction studies. And then we formulated a strategy where you can find that this key residues are important in special interactions. So these interactions can be taken into account when you develop about something better statin therapy, because statin therapy is also getting attention due to its applications. So you need to find out the ways where all these isoforms, or which isoform can be models, or which isoforms can be used further for the better statin therapy. The second study which we want to present is that the xylanases. Xylanases is a very important enzyme, and I'm working with this enzyme since 2009. And when I started working on it, we got a strain where we were working for biobleaching. But certainly we got a new angle that the xylanases which we are working, they are not only useful for biobleaching, they are also useful for the biofuel production. So we focused it, but because that time I was not using, or we were not using the computational approaches. So then we documented all protein prophecy of this xylanase, because all type of application of this xylanase should be used. So what we did, that we got this xylanase from our own isolated strain, that was Thermomyces lanuginosus, and we found we did the molecular docking with various xylans at substrate. And if you see, this was the active site, tyrosine 77 was found in the active site. So we modeled this structure and found the bonding interactions between the amino acids. And if you see, this was the interaction of various xylan. So this Y77F was very key residue along with the Y77R mutant. These two mutants were quite important for getting good interaction with this xylanase. So we tried to model this structure, and complete protein function was described using different types of in silico tool. And we documented this whole together in computational strategies towards improved function prophecy of xylanases from T. lanuginosus. So if anybody wants to work with this particular xylanase, especially from this isolate, they need to see that there are new clues which you can use for various type of other functions of the this particular xylanase. Further, coming to the third area, which I briefly explain you, that is a metabolic engineering for therapeutic proteins. So this is a very long story. I will cut it short to tell you the brief outcome of this, that the metabolic engineering for therapeutic proteins, we tried this, working on it in 2013. So the IPCA laboratories in Mumbai, they approached for understanding that whether we are able to model this particular protein, or we can do the therapeutic protein production in a better way. Because you know, these days therapeutic proteins, especially MAPs and all these vaccines, are very, very important. So you need to understand that how the cost can reduce and how these enzymes are produced by the industry. So we try to see that whether these platforms can be used. So we see that we studied that if you adopt a very customary process, we are getting these type of products. So when we try to evolve this strategy, so this strategy was used in our lab, where we did the complete technology innovation in the E. coli for process and yield improvement. So if you see the advanced technology, we used all steps, not only one step. In clone development, we did fusion tags, halo tags, sumo tags, and we also use the novel promoters, as well as we use glycoengineering tools for getting all those high input, along with fermentation, because we are using small fermenters. So in the industry, we used microbioreactors for clone and process screening, also optimization in a very innovative approach. Along with purifications, when you talk about the protein purification, there are so many techniques. But we used innovative protein production technologies by using iFold KISS, DSP optimization, and other aspects. So this we documented together, and advanced technologies for improved expression of recombinant proteins. And you can see now coming to the main issue was that accumulation of the waste product. So lactate and ammonia, these are the waste product which were accumulated during this production. So both of them, they were reducing the cell viability and the productivity. So industry, they approached that, can you do that? So we applied this model here, and this is the metabolic pathway of CHO cells. And if you see, this is amino acid routine amino acid metabolism, which you need to study, and we studied it together. So we find that we can do alteration in this pathway, and we can do the metabolic rewiring of the cells for getting more enhanced production as well as the productivity. So what we did is that we did the cloning of pyruvate carboxylase and characterized it. We created engineered CHO cell. We also tried to co-express, and then we assess the product yield and quality. So what we did one by one, I will briefly explain you. First, we cloned the microbial pyruvate carboxylase gene in E. coli, where we use this host cloning vectors. And this was a standard protocol. But before that, we also did the codon optimization, because it is very important to have the codon optimization, because you can also see that following cis acting sequence motifs can be avoided. And this was the strategy one, where we cloned PC in PCHO12 and PCHO13 vectors. All these vectors were purchased, and these PC gene was cloned in these vectors. Accordingly, you can see that this is the PCR cloning of this PC gene, and we got very good result of the cloning. And this was the workflow for the normal routine workflow, but we did the clone purification and confirmation by RD with this particular enzyme. But also we care about the glycerol bank preparations, because sometimes the clones, they don't work after some time. So we should have a long-term storage plan, so that we should not be having the cost involved in the previous studies. So then also we have a second strategy, because all these industrial programs, they're based on 2 or 3 strategies. So we also clone in PCHO11 vector as well. And you can see that it was successfully cloned. And we concluded from this that the PC gene was cloned in all these vectors, and also the vectors were characterized, the plasmid DNA was prepared, and linear transfection into CHO cell was achieved. Then we tried to create the engineered CHO cell. So we did the transfection, and this was the cell line development and process flow. So this slide gives you the complete story about how these cell line development can be done. So during the PC transfection methodology, we use this cell line, that is CHOS cell line from in vitrogen. We use neon electroporation methods, and this was the transfection media which we have used. So in strategy one, we cloned PC in PCHO12 and 13 vector, which was very successful. Then we transfected it, we electroporated to get the optimization of electroporation conditions, and also we generated the stable pool. Before I move to the next slide, I just want to explain you that the industry wanted these green dots, means more producing cells, high producing cells, because they were having this problem that there was very less production and also high cost was there. So we tried to see that whether we do 1, 2, 3, and 4th step. If you see 3rd step, cell line engineering, and cell pool 2, you get high producer cells in great number. So this was the pool generation scheme, where we used the co-transfection technology with different selection precursors. And we concluded that though we didn't got high significant PC expression by the ELISA test, and even at higher concentration of the selection pressure, the vector and host also didn't work. So it was not completely failure, but we got some discontinuation for this particular thing. But we evaluated with the strategy, second strategy, and then second strategy was more successful, and we have gone with the this second strategies. So second strategy, we used PC gene into PCHO11 vector, and we cloned it. The same method were used, same media was used, but we make sure that we use the construct with clone 3, which was more production. And this is the cell pool generation scheme which was used. And this is the PC expression profile by sandwich ELISA. We got very good PC expression from this scheme, as well as we did the mini pool studies in the shake flask, because before going to the pool selection and industrial production, you need to see that whether the mini pool studies are better or not. Because in case your cells are not high producing cells, and you do for the industrial scale production, the whole experiment can be repeated for higher production. So all the cost involved in this has to be, and you know the cost of the production of MABs, which is very high these days, and we wanted to reduce it further. So we did the single cell cloning to confirm it, And this is a very good result. If you can see that we did the FACS cloning, FACS studies to see live cell imaging of the cells. And you can see from day 1, I think you can see this, day 0, day 3, day 7, day 12, day 17. I will show you separately as well. And then pool 2D was selected from highest concentration of selection agent, and then highest density we have got as compared to the parental cells. Also, the viability was very good at day 14, and then culture longevity was also very good. Also, the main problem was the controlled lactate was lesser, and 2D was selected for the cell development bar. So this is the single cell cloning and clone selection method which we have done. So what we did is that we get the stable pool, then we screen 500 clones and then selected top 10 clones. And if you see, this is again a broad view. Day 0, the clonality studies. Day 1, day 2, day 5, day 8, day 12, day 13. So you can see the clone imaginality and the production of the clones are getting better by day. And day 13 was very good, very crucial for us, and we got maximum clone study. So this is the complete workflow, and this was adopted by us in the industry, and it was very successful. So as I explained you, we have to do this. This is not the study which we can complete up to this. Top 5 clone, again, you have to select the best clone and do the clone purity, metabolic profile, cell culture, protein RNA, gene copy number, and stability to take it further for the map production. So we did this study, and if you can see that this was the result of clone selection, which we did through FACS, and this is the PC clone shake flask studies, and you can see here this is the early drop of the production. But if you can see here, PC clone 13 was also very good, and clone 9, 12, 13 were metabolically controlled, and the culture conditions were same. It was not changed, but we got very good control of the lactate profile, which was very, very important. Here, cell viability was also increased on the day 14, you can see here, but we got very good results here. And if you see the comparison of the cell culture profile of the clone 12 versus parental, again, you can get this picture, which is very, very good. And clone stability was, the clones were stable up to 60 generation. This is a very good feedback for us that we were able to get successful results for this. So what we summarized is that clone 12 has less glucose and glutamine consumption, high lactate consumption, and less ammonia accumulation. And these were the problems. The lactate consumption has very lactate accumulation, and ammonia accumulation was major problem. So when we are getting sorted out this problem with this clone, it means we are successful in metabolic engineering this particular aspect. So then we did the PC expression and gene copy load number with different types of qPCR scheme. And then we also check the gene integration check and copy number of different clones, not only one clone. So if you can see, then we did the process feasibility for industry, where we did this media feed optimization, process parameter, and cell line engineering as well. So this is a screening workflow where we get the right clone and then try to see the various screening and using different type of HTP tools and all these advanced techniques to understand how these clones can be further taken. So process feasibility of the selected clone, we did the adaptation in different media, we did the feed studies, also we checked the metabolic profile. So we got very good results as well. These were satisfactory. So we concluded that we achieved with this clone peak cell density, the cell viability was also very good, lactate consumption profile was also studied. Then these were the criteria, and we came to know that if we work with this clone, we are getting to have high producing cells. So finally, we did the co-transfection for getting map gene and engineering. So we did transfection with map producing cells. And if you can see the results of ELISA, it says that it has a very good results for this particular gene expression by PYC expression studies. So we tried to see the comparative fed batch studies before going to the fermenter. So we did the glycosylation studies to understand. So we got a good results of increased galactosylation by 2.5-fold whereas the manoacylation was also reduced by twofold. So this increased the serum half-life, as well as charge variant study we did for the first time, because I till 2017-18 nobody has studied this charge variant, but we did map charge variant studies. But unfortunately, we didn't got no major change in the charge variant profile. And then we did all these studies together. So finally, we concluded that PC engineered metabolically controlled cell line can be a very good expression platform for the production of therapeutic proteins such as MABs. And these are the important outcomes that we got. This density, 26 million cells per ml, increased longevity 2 times more than that, significant increased lactate consumption, glycosylation, as well as optimal PC gene 3 to 4 copy number. This is reported for the first time in 2017-18. Now maybe somebody has done it, so I cannot say about that, because when we published, we compared this study with the other studies. So these are our studies which we achieved. There was no report of codon optimized PC gene engineering, but we did it for the first time. Again, gene copy number, no studies were there. We did it for the first time. The highest peak cell density was reported 14 million. We reported it 26 million. Then 75% cell. Hello? I'm audible? I'm audible?
Kapil sir, please mute all the other aspects apart from
the
lecture.
Clearly audible. Please go ahead.
Okay. So then titer improvement was also there, and you can see that we improved this galactosylation and manoacylation, which was not done by anybody till 2017. So this we published in PLOS1 as metabolic engineering of CHO cells for robust production process. And I am very thankful to the IPCA laboratories for funding this innovative work. And this paper is available because it is online, freely accessible. And then also we published very good reviews on these technologies, because it is good to learn all that and publish. So this is a microbial platform technology for recombinant antibody fragment production and gene editing for cell engineering. This is also a very good paper. A lot of people are citing this paper right now. And again, we documented for the researchers, the budding researchers, how these sophisticated cloning, fermentation, and purification technologies can be used. And then also we documented this overexpression of codon optimized yeast PYC in for augmented lactate metabolism in frontier in pharmacology. There are some other lines of research of biofuel and all that. I don't want to give it right now. Maybe some other time I will give you. But this is a very good book which we wrote with my collaborator, Professor Vet. Here you can find most of the advanced technologies of enzymes which are used and which can be useful for the various researchers. This is a new paper which we are trying to see that how engineered microorganisms can be used for bioremediation. So we are still working on it. Maybe in a few coming years, we will be able to come up with some good stories for you. These are our collaborators. So I thank Professor Yutaka, Professor Dhiraj Sinha, Professor Plau. For enzyme engineering, I learned from Professor Plau in Spain and Professor Yutaka, as well as from Norbert Carlson from Sweden. And I spent time at University of Cincinnati, USA. So we have collaboration on that. And Professor Brett is a leader in enzyme technology, enzyme synergy. So we learn a lot of things from them. These are future lines of research. My other students are working. I will show in the coming slides. Anybody interested in all these lines, we can collaborate together. So this is a new paper. This came last month. That is the trends in genetics, about how that genetic engineering and metabolic engineering for pathway expression can be done. And this paper I can share whenever you require it. It is basically the sigma factor mediated regulation of PSB gene in cyanobacteria for different type of product, not only one product. So, and this is another, my student Twinkle wrote this bioinoculant capability enhancement for various purposes of agriculture. This is my web page in BHU. Recently, I have came to this place. I have joined this place. This is our laboratory, enzyme technology and enzyme Protein Bioinformatics Laboratory. These are my present PhD students. Twinkle, she works on bioinoculant. Monica, she works on probiotics. Dinesh, he works on algal biopigments and synthetic biology. Sunita, I think she might be participating in this conference as well. She is computational vaccine designing, focusing on especially the vaccine tools which are used in silico tools. Issue, she works on prebiotics, and probiotics is used by various type of machinery and how prebiotics formulations can be done. Babita works on microbial bioremediation. These people are finishing their PhD and they will be submitting. Shweta is there, Mandeep is there. Along with that, because you cannot do everything, so you have to collaborate with people. So I try to have trainees, like Rajat was a mechanical engineer, so he taught us about artificial intelligence and microbial biotechnology, how it can be used. Arun was a short-term research trainee and postdoc in our lab. He learned that protein engineering tools. Ashwini is also mechanical engineer for optimization. Dinesh is also mechanical engineer. So these are students, few MSc students who were in the list. They contributed effectively for all the work which has been presented here. The past PhD student, most of the work which you have seen in metabolic engineering of CHO cell was done by Sanjeev Gupta. Dr. Sanjeev Gupta, he is presently the Deputy General Manager at IPCA Laboratories. And then Jahangir is there. He is working with Forensic Science Laboratories. Rameshwar is postdoc in South Korea. Dr. Chiranjeev Banerjee is Inspire Fellow at IIT Dhanbad. Dr. Shripal is Associate Professor at BIT Mesra. Dr. Puneet Singh, he worked with me since MSc and PhD also. Now he is a very good expert of computational vaccinology in Australia. Vishal is also postdoc in South Korea. Smriti is there. And Ruby, Mehak, Vishal. So this is a, I think 2-3 years back photo of my lab group. All students are there. And I acknowledge Banaras Hindu University, Varanasi, Maharshi Dayanand University, Rohtak, Department of Science Technology, DST Fast Track Grant, Department of Earth Sciences, UGC, Indo-US Technology Fund and ASM, University of Cincinnati, Durban University of Technology and IPCA Laboratories, Mumbai. Thank you very much.
Thank you, Professor Shukla. Can you hear me, you all?
Yes,
Hello?
yes, sir.
Professor Shukla, your lecture was, clearly visible and audible both. You have presented a very good lecture. Thank you so much. And we were well in time. You have taken a bit more time, but no problem. One question can be entertained from the audience, please.
Dr. Kant has a question, sir.
Please.
ठीक हो गया अंकल जी.
Sir, you're mute, sir. Rajiv Kant, sir, you're mute.
Hello, nice lecture, Professor Shukla.
जी अंकल जी.
अंकल जी
कहाँ से आ रहा है? आवाज कहाँ से आ रही है?
I think somebody else is there. You can ask your question, Dr. Rajiv.
Please.
Okay. One question I was wondering, that you said there is a change in glycosylation, amount of glycosylation. So you have looked at the amount of glycosylation. Did you look at the immunological aspects of this post-glycosylation?
As I told you, we did very screening only for the glycosylation. So we have not done immunological studies because the industry has given two tasks. The first was that whether we can efficiently produce these maps, or we can develop a platform or novel expression platform for enhanced production in less cost. So we achieved both aspects, but we did glycosylation studies to see additional features, but we didn't able to complete all the immunological studies.
Yeah, because generally if there is change in glycosylation amount or pattern, it is actually raising the red flag.
Okay.
Thank you, Professor.
Okay, thank you.
Dr. Singh, shall we go to the next lecture, sir? Sir, your mic is mute, sir.
Oh, sorry. Yeah, I'm. Once again, thank you very much, Professor Pratyush Shukla and Dr. Vijay Tripathi. What next, please? Who is the next speaker?
So now oral presentation will be going on.
So Vijayji, I thank you all again.
Thank you, sir. Thank you, sir.
Yeah,
thank you
you for giving me opportunity to present my work, and thank you, Professor Mohan MP Singh, sir, and also Professor Lal, Jonathan Lal, Professor Lubina, and other colleagues. We will try to see and meet again all together. Let's see.
Thank you, sir.
Okay, bye.
Bye, sir.
Bye. Bye-bye.
So now this is time for the oral presentation from the students. So first presentation will be Dhruv Aditya Srivastav. Dhruv Aditya Srivastav is here. Dhruv.
Dr. Sahab apparently is not joined the panelist. How many do we have presentation wise?
Sir, I just allow.
Hello. Dhruv has joined. Dhruv has joined.
Yeah. Now is here.
Hi. Hello.
Hello.
Can you hear me?
Yes. Dhruv?
Yes, we can hear you.
Yes.
But you are not visible, Dhruv?
Yes, I'm trying to open. I think like it's different settings here. I'm trying to open the video here somewhere, which I don't see.
On your video.
Probably I don't have the authority here.
Dr. Tripathi, permission has to be given to Dhruv to join the video.
Yes. He has permission. He has permission.
Okay.
Dr. Vijay, I don't see that I can share my screen. Can I share my screen? From
Dr. Sahab, in the middle it's written.
Dhruv can.
Yes, sorry, go ahead, Dr. Tripathi.
Dhruv,
just share your presentation. Now you have access.
Great. Oh, yeah, great. So I think now you can see me. Yeah. Hello. Good evening, everyone. So thank you, Dr. Tripathi, for the invitation. So I would like to share my screen now. Okay. Yeah, can you see me and hear me properly? Hello.
Yes, you are audible and visible both clearly.
Oh, great. So thank you all the organizers for inviting me for giving a talk here. I think I have like limited time, so I will be a bit fast. And if you have any questions, you can always ask me in the middle or also in the end, whatever is preferable. So so this particular talk, I am presenting here the work which we did almost a year back. We published. So my name is Dr. Dhiraj Sinha. I'm from lab of Dr. Maggie Levy in Department of Plant Pathology in Hebrew University of Jerusalem. So the work I'm presenting here is our lab is expertised in glucosinolate breakdown products from crucifer plants, and we were trying to find mechanism by plant pathogens to escape these products. And we know that Botrytis cinerea has some resistance to this kind of product. So I'm going to talk about that. So first of all, what is Botrytis cinerea? So it's one of the top 10 pathogen in the world. Is causing one of the largest loss in economical losses, and it is a necrotroph, which means it like prefer to kill the plant first and then go on to eat it up. And it's very, very diverse. It has various forms, like various species are there and various subspecies and it has very wide host ranges. So what we work on is the basically mustard. It's also called mustard oil bomb. And what happened is when the plant has any damage due to insect or due to fungi, when they break the cells, they have glucosinolates which are coming to the cell, and in the cell there are myrosins which are causing to break these glucosinolate. So they are called glucosinolate breakdown product. And in particularly, I will talk about NCS, which is isothiocyanase, ITCs. So these are the most abundant thing which are produced when the mustard bomb is actually blown, basically. So what we did, first of all, we started to look for resistance in these, and what we found is that we did a transcriptome analysis, and which we found that we tried to find new kind of transporters probably which will make fungi resistance to these kind of breakdown products. So what we found among all the MFSs, it's a family of transporter. Only one of the MFS was really highly upregulated. So we went on to look why it was hypothetical protein and it was not well characterized. So we went on to work on this particular protein. So what we saw in the beginning, that there are different kind of ITCs, and there are propyl ITCs, benzyl ITCs, and phenyl ITCs. These are few of the family which represents the ITC, these breakdown products. So what we saw that when you grow the fungi with the ITCs, these ITCs, you see that there is upregulation of this particular gene, which we term as MFSG. So I will say that in the presentation. So this particular protein was upregulated. So we see a clear correlation between if you have more ITCs, this particular protein was upregulated. And later on, we found. Next on, what we try to do is we try to make knockouts of these particular gene, and we made those knockout and we complement that. And what you can see here that the expression of MFSG is low in knocked out one. There's no expression, and in the complementation we would complement the protein back. And and if you see the expression again, like in the previous from the previous slide, this is the growth inhibition. So what is growth inhibition is like, if it is more high, it means the fungi is more inhibited. So here you can see when you have knocked out the two lines of knocked out mutants, you see higher growth inhibition. As you go higher in concentration, you see more inhibition. So, and when we did the complementation, which are these two lines, you see they are growing like the wild type again. So how did we show that it's actually responsible for moving the ITCs, different ITCs? So first of all, we tried to do docking, which I'm not showing here. We did the docking analysis, and we showed that it not only dock few different ITCs, which I showed in the previous slides, but also it can move FITC, which is a fluorescent ITC, into the protein, the transporter protein. So here you can see we have the mutant and the wild type, and you see we did the measurement of fluorescence, and you can see that the fluorescence was much more lower in wild type compared to the knockout. So it means that the fungi could not take out the ITCs. So this was actually, we can say we were a bit lucky on that, because it is very tough to see BITC or any other ITCs to go out of the cell. And here you can see visually. Next on, we show the same. We went on and tried to see how does it do in the plant itself. So we have like 3 different lines of plants. This is the wild type Columbia, and this is TGG12, which is a knockoff of 2 mutants, which basically myrogenases, and so you don't have any ITCs form into the leaf tissue, and this particular mutant has a lower amount of ITCs, and this mutant is very high activity of myrogenase, and which cause a lot of high amount of ITCs. So here you can see that in wild type you have infection rate are very high, but this is Columbia leaf, and in knockout you see less infection. And in terms of lesion size, you can see that in the high ITCs containing plant has smaller lesion sizes. So this is what we show in plant. And next on, we move this particular gene into the yeast cell, and what we found that in yeast also we see the similar effect. We see that it can remove the FITC, and which we shown by microscopy and FACS analysis. And also when we did this alive cells, we try to measure the live cell in when we added BITC, we see that it's more able to survive in BITC's level. So this publication we published in previous year, and this is the paper which we got. So in conclusion, what we found that this particular transporter is responsible for glucosinolate breakdown product detoxification. Its gene can be moved to different fungi and can give a same resistance. So understanding these kind of transporter and mechanisms is very important for understanding how the drug resistance can happen in plant pathogens. So that's why this study is very important. So I would like to thank Hebrew University and David, who was the main, who was actually pushing the project along with me, and other co-authors, and my PI, Dr. Maggie Levy.
Thank you, Dhruv. We are running short of time. Thank you so much.
Yes, I understand.
For such a good lecture. Who is the next speaker? Dr. Vijay Tripathi, please name the next speaker.
Yes, sir. Next speaker is B. Surumi. B. Surumi, you are here.
Dr. Sahib, if she is not available, please go to the next speaker, sir.
Yeah.
She is here, sir. She is here.
Okay.
B. Surumi.
B. Surumi.
B. Surumi. Are you here?
Can you hear us, Miss Surumi? Surumi.
Surumi is here. Please unmute, and then it is showing in attendees. B. Surumi.
Maybe some technical issue. If she's not able to join, we can go to the next speaker and come back to her in the next one.
Yes, sir. Shilpa. Shilpa, are you here?
And then Shilpa. Hello, Shilpa. Then next.
Shilpa, please unmute. Shilpa is here.
Yeah, Shilpa is here.
Yeah. She is here.
Shilpa, unmute and then give your presentation. Yeah, Shilpa, can you hear? Shilpa is here. Shilpa, Surmi, both are here. Hello, Shilpa.
Audible, sir?
Yes. Go ahead.
Okay, sir. Good evening, all. Today I'll be presenting a small work on Drosophila UAS Galfo system for decoding the mechanism in the development of autism spectrum disorder. So my slides are visible, no?
It is visible, Shilpa.
Okay, sir. So autism or autism spectrum disorders are a group of neurodevelopmental disorders which are characterized by synaptopathies and behavioral deficits. So several environmental risk factors contribute to the pathology of ASD. Mainly, heavy metal exposure increases the risk of autism. So lead is such heavy metal occurring naturally in the environment, and it causes several neurological, reproductive, cardiovascular, and gastrointestinal toxicity. So heavy metals like lead are also known to cause the oxidative stress. It causes ROS antioxidant imbalance, causing damage to proteins, membranes, and genes. So the major objective of our study is to characterize lead-induced autism model by correlating oxidative stress, DNA damage, brain ultrastructural alterations, and behavioral outcomes in Drosophila model, and also to study the effectiveness of Drosophila as a model for autism spectrum study. So we have used Drosophila as a model because of several measurable endpoints like lethality, morphology, behavioral traits, and also human and Drosophila brain architecture and functions are similar. So in our experiment, we have exploited the Drosophila UAS Galco system. It's nothing but a bipartite approach in which two independent transgenic lines contain a target gene and its transcriptional activator. So the transgenic driver line is mainly crossed with the UAS line, resulting in the expression of gene of interest. So moving on to the materials and methods, we have treated lead acetate to the third instance largest Drosophila and in the whole developmental phase, and adult male was selected for the subsequent assay. So lead accumulation was mainly quantified using atomic absorption spectroscopy, and lead-induced oxidative stress was assessed biochemically. Oxidative stress-induced DNA damage was measured using COMET assay, as well as neuropathological alterations were quantified using light microscopy and transmission electron microscopy. Then the oxidative stress and neuropathological alterations induced behavioral assays were quantified. Here we have used several strains of Drosophila, mainly Oregonard strain, which is the wild type one, and MB247 Galfor, which is the mushroom body Galfor in the Drosophila brain. Then UAS SOD and CAT splice, which overexpress these two antioxidant genes, and UAS SOD IR and CAT IR, which is the RNA interference strains. Moving on to the results, if we see the FC50 of the lead acetate was determined as a toxicity measure in different strains of Drosophila, and the sublethal concentrations were selected from 0.2 to 0.8 millimolar. Then after lead treatment with the sublethal concentrations of lead, we have found that lead may be accumulated in the brain of Drosophila. Also, if you see the oxidative stress generation in the Drosophila brains, we have seen that increased level of LPO and ROS was seen in the wild type Oregonard strain and as well as RNA interference strain of SOD and CAT. This overexpression of SOD and CAT rescued the oxidative stress generated by the lead. Also, if you are seeing the effect of lead exposure on the antioxidant level, we have found that lead exposure significantly reduced the antioxidant enzyme and both biochemically as well as mRNA transcript level. Also, SOD and CAT overexpression rescued or made a protective effect on the antioxidant level by increasing that. So DNA damage was also quantified. I found that oxidative stress induced the DNA damage, which was quantified using both FPG and endo3 enzymes. Lead-induced DNA damage in all concentrations, and FPG enzymes induced more compared to that of the endo3. Also, SOD and CAT overexpression rescued the DNA damage compared to that of the wild type. This is being represented in the table and percentage. And if you see the neuropathological alterations in Drosophila, pathological alterations are mainly detected by hematoxin and eosin staining in Drosophila, and has found that higher number of neurodegeneration which is seen as a measure of coagulation in both wild type splice as well as RNA interference strains. In the case of SOD and CAT overexpression, we have found that the neurodegeneration was significantly ameliorated. And this neurodegeneration was quantified as a measure of coagulated areas in micrometer square using imaging and has been represented in the table. We also looked at alterations of Drosophila brain, and we have found that SEM analysis of the neurons of wild type Oregonard upon lead exposure showed swollen neurons as well as dilated endoplasmic reticulum as well as fragment of endoplasmic reticulum. Even the control Oregonard or wild type strain showed electron dense regions, cytoplasm, and intact cell structure upon TEM analysis, whereas higher concentration of lead treatment, that is 0.8 millimolar, shows irregularity in the cellular structure as well as less dense cytoplasm. Also, lead treatment showed a dense chromatic region in the cytoplasm of the neuron. Also, altered crystal
Please
morphologies.
conclude.
Okay. Like this,
Conclude,
synaptic morphologies have been observed, which led to the behavioral alterations such as altered climbing, increased grooming, which is a mark of this autistic-like behavior, as well as decreased social interaction, which is seen in autistic patients, as well as decreased learning and memory. Thank you, sir.
Okay, Silpa, thank you so much. Next speaker, Dr. Vijay Tripathi.
Yes, sir. Next speaker is B. Surumi. B. Surumi, you are here?
B. Surumi, can you hear us? Hello?
Okay.
B. Surumi.
I think she's not here. Dolly Rani. Dolly Rani?
Dolly Rani is here.
Yes,
Dolly
sir.
Rani?
Yeah, please present your work.
Yes.
We are already running short of time, so try to finish it within 5-6 minutes, 7 minutes. Okay, Dolly.
Hanji sir.
Chaliye.
Good evening, one and all. I'm Dolly Rani, PhD scholar from CCS HU Hisar. Today I will present my work plan on fungi-mediated synthesis and characterization of iron nanoparticle. So I will start by giving a brief introduction.
Okay.
Over 1 billion of people around the world are affecting from micro malnutrition, especially in developing countries. Iron deficiency is the main concern out of these micronutrients, which reduces nutritional quality of soil. Recently, the application of microorganism leads to the synthesis of non-toxic and eco-friendly nanoparticles, which can be used as nanofertilizer and nanobiofertilizer for precision agriculture. One of the popular means of nanoparticle synthesis is by using fungi because of its easy handling, and it can be used in 2 ways, by extracellularly and by using fungal biomass. And the aim of the present study is to synthesize iron nanoparticle using fungal biomass and extracellular filtrate on different iron salts. These synthesized nanoparticles will be further tested for their plant growth promoting activities. These nanoparticles, along with growth promoting bacteria, will be applied to crops to evaluate their effect on nutritional content and crop yield and on soil microbial communities. Firstly, to achieve these targets, we have selected the metal contaminated sites to isolate the iron tolerant fungi. These are different fungi which we have isolated from different metal contaminated sites. Then out of these 25 isolates, only 4 fungal isolate has shown the maximum tolerance at 40 millimolar concentration of iron salts. Then is the synthesis of nanoparticle. We have selected the fungi which grows at maximum concentration of iron salt for the synthesis of nanoparticles, which were then optimized at the different iron salt concentration, and the maximum synthesis was observed at 10 millimolar concentration. So accordingly, we have grow the fungi in broth and collect broth, and then from this broth we have collected we collect the filtrate, and the filtrate is then added with iron salt. Then the color change is observed from yellow to pale yellow to brown, and after that fine nanoparticles were centrifuged and collected for further study.
Come to the result. This synthesis is well known. Okay, come to the result.
The UV vis and the FTIR was done for to characterize the presence of nanoparticles. So according to UV vis spectrophotometer, the peak was observed at 250 to 320 nanometer, which shows the presence of nanoparticle, and the FTIR shows the presence of potential functional group present in the nanoparticles. So this shows the presence of FEO nanoparticles in the range of in different ranges, shows the presence of FEO functional groups. And the conclusion of my study is that I have concluded that the maximum tolerance was shown at 40 millimolar concentration, and we have also standardized a method for the synthesis of iron nanoparticle from fungus. And the future perspectives of our research is to synthesize eco-friendly nanofertilizer, which will be used to enhance the nutritional content and the yield of the crop. Thank you.
Thank you, Dolly.
So next talk is Hari Om Saran.
Hari Om Saran.
Hari Om Saran, are you here?
Hari Om.
I think he's not here.
Okay, next.
Vinayak Rudra. Vinayak Rudra, are you here? I think, sir, he's not here. And last call for the B Surmi. B Surmi, are you here? I think, sir.
डॉक्टर साहब अगर वो बाद में आ जाते हैं ड्यूरिंग द प्रेजेंटेशन उनको जोड़ लीजिएगा जो अभी एग्जिस्टिंग उनको करवा लीजिए
हाँ हो गया लास्ट ही थी
This is the last one. This is the last one. So for today's I think we are over.
I'd like to conclude the session.
Yes, sir. Yes, sir.
So this was can you hear me? Am I audible? Be sure me. Hello. हेलो आवाज जा रही है मेरी? डॉक्टर विजय?
Yes, sir. Yes, sir. Yes, sir. You are audible. Yes, sir.
Presentation नहीं है ना? Conclude करें ना?
No, sir. All presentation is finished now.
Okay.
Just conclude the session, sir.
I'd like to express my gratitude and thanks to Dr. Vijay Tripathi, Professor P.N. Pandey ji, Professor Jonathan ji, all my colleagues, friends, dignitaries from all over the world. This was a wonderful session. It was having 4 invited lectures. It started with the wonderful lecture by Dennis Horgan. It was informative, timely. He gave a lecture on the personalized medicine healthcare system, followed by the ED Citrin on wastewater management, reuse, recycle, this which is one of the important topics, followed by the Dhiraj Sinha, and who talked about the pan-genome analysis and virulence profiling, data management after sequencing, and so forth. And in the last of the invited lecture, it was by Professor Pratyush Shukla on the applied aspect of enzyme technology and metabolic engineering. And then there was oral presentation by Dhruv, Shilpa, and Dolly. And as the chairman, I'd like to express my thanks, gratitude to all of you. Thank you very much. And now over to Dr. Vijay Tripathi.
Thank you very much, sir. Thank you, sir. So now I am going to end this session. So we will meet again tomorrow at 2 o'clock for the day 2.
Okay.
So good night.
Okay, bye. Good night,
everybody.
Wonderful.
Thank you, Dr. Tripathi. Very well done conference. It was very entertaining. It was very informative to listen.
Thank you, sir. Thank you very much, sir.
Thank you.